Now resume the Standing Finance Committee meeting. We at item 009 under subhead 04, page 219. Member for Shogunas East.
Thank you very much, Madam Chair. Just like to get some information, if you could give us the state of the emergency ambulance service. I see you have an allocation of 126 million. In view of the fact that there have been concerns raised in very many quarters about the efficiency, the response time of the ambulance service and the level of the state of readiness of these vehicles.
So, on assuming office, and I agree with the honourable member, the GMRTT response was not what it ought to have been. And I said when we were examining the issue of drugs that the Ministry of Health abdicated its role in providing monitoring and evaluating systems over its contract partners. And I quoted in the deck, and I did mention GMRTT. In establishing a monitoring and evaluation department within the ministry to look specifically at our major contract partners, I could tell you that the efficiency of the ambulance service has increased dramatically. It is not perfect as yet. But because we are paying close attention and we actually go out now, that team actually visits GMRTT to do audits. And the response time has in fact improved. And the number of complaints you are getting from the general public, if we are honest, has decreased significantly. But we continue to do the work to get them to move optimally.
What about, Madam Chair, can I continue? With respect to each of the RHAs,
yes.
If you are subdividing them, what's the optimum number of units for each of these RHAs? And what's the current strength of the number of, do you have it?
I don't have that with me now, but I can certainly get that for you. I think that's important information. So I will endeavor to get that for you, sir.
Right, but in your view, do you think that there's a shortage of the number of units that can respond to each RHA?
There is, in my view, a need for more ambulances, and that, in fact, is happening as we speak. In my meetings with the head of GMRTT a few months ago, he indicated a rollout of new ambulances, which are currently being fabricated in Trinidad and Tobago. So new ambulances are going to come into the system, but we have to make sure they comply with the regulations.
Member for Finance.
Thank you, Madam Chair. Minister, just a follow-up to this, and I don't want to jump yet to 07 on
sure.
the transfers, but I just wanted to link the National Emergency Ambulance Services Authority allocation of $2 million.
Which line item, sir?
That would be 07.
Yes.
I know we're talking about region RHAs, but it relates
yes.
to the ambulance service. If you can link the two, and what really is the function of that authority and where is it at the moment?
The function of the authority is to oversee the operations of all ambulance services in Trinidad and Tobago, inclusive of, as I understand it, GMRTT, to also have some input into the fire ambulance service and the emergency ambulance service, and also the ambulances being owned and operated by the individual RHAs. So it's an umbrella body overseeing ambulance services in Trinidad and Tobago.
And just as a follow-up, madam, now I see, and just for the purposes of accounting, I see that the emergency ambulance service is under the RHA. Is it going to be procured under one particular RHA, or is it going to be...
Sorry, which
procured?
line item, sir?
We're going back to 01 Regional Health Authority.
01, right? Mm-hmm.
And that would be italic 1.
Mm-hmm.
I'm just wondering why it's linked under RHA as opposed to the Ministry of Health.
Hold on, let me just confuse it.
And the question was whether it will be procured through a particular RHA.
Okay, I am told it's under a general RHA vote, and not under individual RHAs.
That would be the explanation.
Yes.
Okay, if I may, Madam Chair. With regards to the AIDS to nursing program, which is italic 6.
Yes, sir.
As you have 32.4 million allocated, I would want to inquire as to the status of this program.
Sure.
How this money will be spent in 2017, and how many people will be employed under this.
As you know, the AIDS to Nursing program was a program designed to put more bodies on wards. The AIDS to Nursing program had 3 tranches. A certain level of training was supposed to have been done with each cohort. My understanding is, which is borne out by actual research, is that the training for cohort 1 actually went very well. However, the trainings for cohort 2 and 3 did not progress as it should have. As the program comes to an end, we will reevaluate the program to see how it could fit into the nursing landscape. And some of the successful people will be taken back to become PCAs and whatever, and hopefully transition into the formal nursing programs.
I would just be curious, Minister, were there any reasons obvious as to why the training for tranches 2 and 3 didn't go as well as tranche 1?
Well, when I came into office in 2015, I inquired. It was just a lack, and again, it goes back to the role of the ministry in having oversight of all of these things. As far as I can tell, we did not have the people at the ministry to really oversee and to make sure the training was in fact done. And this is something we are now trying to correct.
Yeah.
But the program is now coming to an end. So we will reevaluate the program to see how best it can fit in.
So this 32.4 million allocation will be for exactly what then?
This will be to pay off the existing, right? To finish pay off the existing cohorts.
So as you speak, there's no guarantee that the program will be continued. Is that what you're saying?
What I'm saying is that the AIDS to Nursing program, while having laudable aims, goals, and objectives, needs to be re-evaluated to see if in fact it adds value, because there are pros and cons to it, and I have had many reports from the nurses who have to manage this program telling me it takes away too much of their time in providing nursing services and management to be training the AIDS to Nursing program. So that is part of the re-engineering of the program that we are going to have to look at.
And just for the public information, ma'am, any idea when the decision will be taken on this as to whether it will be retained or not?
I think a decision could be made within 6 to 12 months.
All right. If I may, Madam Chair.
Karenese.
Madam Chair, I have a few questions under this subhead 01 to the left, right of the page. Can I go through each one? You want me to go through them individually?
Please.
Yes. Roman numeral 4, the pediatric cardiac surgery. Honorable Minister, we had a sharing of program with international hospitals, helping and international consultants coming down to help in pediatric surgery cases at Mount Hope. Do you think that this 2 million, what would this cover? And are you going to connect back to these institutions and doctors who have been assisting in the past with the pediatric surgery?
Okay. Number 4, as I understand it, it's $2 million, which will go to Caribbean Heart Care, I believe, to provide pediatric cardiac surgery. We have no intention of stopping that program or stopping any relationship with our partners abroad. As a matter of fact, we need to encourage that transfer of technology and transfer of learning. So I can assure you that any program to partner with external sources will be continued.
Okay, thank you. I'm glad that that is continuing. Well, item 5 is within my field.
Yes.
The screening, I'm glad you're continuing to give the support to the Cancer Center, the
Yes.
Cancer Society. But is there any contemplation, since you said that you're doing some visioning for the ministry, for a more widespread screening for cervical cancer, because only 6% of the patient is screened on an annual basis, and the same patients come back for screening. And for breast cancer, I think the time has come for increased screening with mammography, because above age 40, a woman should be screened every 2 years, and up to age 50 every year. But we don't have that facility. Could you consider somewhere along the line that you start that program? Because you know breast cancer is the #1 killer for women in cancer, and cervical cancer is the second. So the time has come. We didn't do it as well as we should have done it, but the time has come for us to do it in a more aggressive manner.
Honourable Member, you have zeroed in on something that is near and dear to me, and that has to do with women's issues. And I don't want to sound Trumpesque if I say there is no bigger advocate for women's issues than myself. I will tell you this. I fully agree with you that we as a society and a country, we have not paid attention to screening for both cervical cancer and breast cancer.
And prostate cancer.
And prostate cancer. The good news is...
And colon cancer.
Yes. And the bad news first is that very often when we catch it, as you know, we catch it at stage 2, stage 3, and stage 4.
Yeah.
Under the NCD plan, funds will be allocated to do exactly what you are recommending. And we are working with our NGOs, for example, the Family Planning Association, who does yeoman service in cervical screening, but they are underutilized, not underutilized, they are underfunded, under-resourced. So part of that funding under the loan we are taking for the IADB is to start that exact initiative that you are talking about. And I look forward to your support in this.
Yeah, I just want to prefer that, that you set up a team to look at a national health screening program from your ministry and to get in other stakeholders.
Yes.
So that you'll have an understanding what is going on at a national level.
And Honourable Member, what I can tell you, just yesterday, Sunday I believe it is, as part of what you are talking about, we had a workshop at Southwest Regional Health Authority for radiologists to start to interpret mammograms. So we are boosting up our capacity to read these reports.
We should put some in the health centers and so on.
Yes. So as we roll out.
Okay. The emergency ambulance service.
Ambulance service, yes, sir.
Yeah. The committee which you try to put a lot of licks on and so on, but
which committee did I put licks on?
Well, when we had the committee helping the minister.
Yes, good.
A question?
Yes. The emergency health service, ambulance service, is hampered by the response time in the accident and emergency department to transfer a patient from the ambulance into the emergency department. Can you give us any idea of whether you have looked into it?
Sure.
That will reduce the amount of time wasted.
Sure. One of the first things I did, and I must thank now the Member of Parliament for St. Augustine. On becoming Minister of Health, when I had this plethora about complaints about ambulance times, on the advice of the Member of Parliament for St. Augustine, the Honourable Prakash Ramada, I paid several spot visits, unannounced visits to accident and emergency rooms across Trinidad and Tobago. Eric Williams, in particular, Port of Spain, San Fernando. And the problem was not the number of ambulances. You know what the problem was? That the accident and emergency departments did not have trolleys to transfer the patient from the ambulance gurney onto a trolley.
So you bought some more?
I immediately ordered the North Central Regional Health Authority and Southwest to purchase more gurneys, and that has made a dramatic increase in efficiency. So now the ambulances don't have to wait 45 minutes and 1 hour as occurred before. They can transfer their patient from the ambulance gurney onto an accident and emergency gurney. And therefore the turnaround time at the A&Es is now down to 10 to 15 minutes in a lot of the cases.
Well, the committee we had
Member, is there a question?
Yes, last one. The committee we had, we felt that and we instituted measures. The legal settlement of 20 million.
The legal settlement of?
20
yes.
million. Could you comment on that?
So that is an allocation in case any of the regional health authorities are sued by former CEOs or anything like that, as is happening now, for whatever transgressions would go in their favor.
Is this
So it's a general fund for legal settlement.
right to come, or do you have part of that for paying in the past?
Part of that for paying in the past. Hold on. Yeah. I don't have those details, but I am told every year we get an allocation for this.
And is it used up, or?
Not entirely as I understand it. It depends on what claims you have.
Member for Chabakit.
Thank you. I want to go back to emergency ambulance service, Madam Chairperson. Minister, in terms of the ambulances, the contract you have with GMRTT, is it a fixed price contract or do you pay per pickup or per call?
Pick up on calls, I believe. Fixed price? It's a 5-year contract which was signed just before the last election in September 2015, and I believe it's a fixed term.
It's a fixed contract?
Yes, that's
Right.
my understanding.
Good. How do you have any idea as to how many ambulances, working ambulances, are supposed to be provided by GMRTT on a 24-hour basis in view of the requirements of the contract, and whether they have been providing those ambulances as are required under the contract?
When I looked
What
in,
percentage?
yes, thank you. When I looked into this contract some months ago, the actual complement of ambulances on the road at any particular time available to go onto the road was somewhere between 25 and 30, which was not in keeping with the terms of the contract.
Okay, but so let me stick a pin there. So then are you paying GMRTT a quantum of money and they have been failing to provide the required ambulances, and therefore they are receiving money that they should not receive?
And that is part of the problem with the contract that was signed in September.
And what are we doing, Minister?
And let me tell you what the contract value is. It's a 5-year contract at $30.8 million per year. And I have insisted that GMRTT get their ambulance fleet up to par.
Minister,
and they have committed to me that they are doing so. As I said earlier, more and more ambulances are
Minister,
going to
I
come
was
on stream.
dissatisfied with this matter with GMRT, even as a member of the last government. I was dissatisfied.
So
and I think that
but you
GMRTT has
clarified.
GMRTT owes the Republic of Trinidad and Tobago money for failing to provide a service and a number of ambulances. And no minister or no ministry could continue to go on paying $30 million a year, and they are not fulfilling the contractual arrangements. That question is, what are you doing about the situation, A, and B? Do we have monies to recover from GMRTT?
I have an updated figure, and the picture is actually worse than I just said.
Right.
It's not $30.8 million per year. It's $30.8 million per quarter.
That's right.
And when I looked at the contract, I immediately sent the contract to the Office of the Attorney General for the attention of Minister Stuart Young to look at. Because the concerns you are raising, I flagged them, and the Office of the Attorney General will advise me.
Chairperson, I wanted to ask the Minister this. Are you aware that the promise that they have been making to supply new ambulances and bring the fleet to the required amount have been made for the last 2 years?
I am told that there are ambulances under construction, but the bigger issue is, are we getting value for money with the contract? And the issue you have raised is an issue which I flagged, and I said it's under the consideration
Minister,
of the Office of the
through the
Attorney
Chairman,
General.
are you prepared to continue the waste, corruption, and mismanagement in the Ministry of Health in this regard?
I think the
Absolute-
Minister has already said it's been sent to the Office of the Attorney General. We will review it and we will take what needs to be taken, the steps that needs to be taken to deal with it in the public's interest, as we've been doing throughout.
Member for Princess Down.
Madam, if we can go through you, Honorable Minister, sorry.
Yes.
If we could go on to line item 06.
06, Children's Life Fund Authority. Yes.
Minister, can you give us an indication over the last year how many applications have been made to the Children's Life Fund? How many of those applications have been successful? And I know I've had previous conversations with you with respect to the pool of institutions that the Life Fund deals with in terms of sending children abroad for these life-saving surgeries. What is the status of that research that you had mentioned to me in terms of increasing the pool?
Honorable Member, line item 06, Children's Life Fund, has nothing to do with surgeries, how many applications. It has to do with the general operating costs of the CLF. That is what that line item is about.
I understand that, Minister.
If it is you want information not pertaining to this line item, I will gladly provide that for you. We have nothing to hide.
Great, thank you
Just yesterday in the Express, you would have seen somebody praising the Children's Life Fund for coming to their assistance in providing a liver transplant surgery. It continues to operate.
Thank you, Madam Chair. Minister, could you give us a little idea as to the vacant post, Roman numeral 7, for 30 million, what that involves, and also, while you're at it, the fifth largest allocation from Roman numeral 1 to 12 is item number 10, other, for 10 million. If you can give us an idea as to what is that 10 million other involves.
You on line item 07?
I know it's easy to say a contingency and so on, but is there any specific category or categories to which other will mean? We know what other means in accounting, but I just want to know whether you had any.
I'm trying to.
00901. In the explanation, the Roman numerals.
Oh, upstairs,
Roman
sorry.
numerals 7 and 10.
Yes, that has to do with contingencies for trade payables.
Okay. And you can give us an idea as to, is it a contingency for the future, or do you have that being allocated for trade payables?
It's there for trade payables.
That you would have incurred?
Yes. No, for what we would have done in 2017.
Okay, and then the one I asked about the vacant posts, 30 million.
Yes.
What are those, what posts do you envisage that will take up that amount of money?
Okay, let me just confer here. This has to do with any vacancies that will arise in any of the RHAs.
Just a question. You know, I will ask the question. I just want to make a comment on it. The experience has been, and mine, being responsible for the former tertiary education ministry, that there are many persons who are coming to us, and to me too, who are qualified, MBBS, doctors, and registered, and are begging for work all around at doctors' offices. Can you tell us how many doctors you are short of, and whether in fact you have any indication as to how many have been applying to the ministry or the various regional health authorities to satisfy that shortage that you may have?
Sure.
So the question is, number one, what is the shortage, and how many persons you know are looking for jobs? Because we have some information as well.
We must not use the term doctors as a catch-all phrase. There are shortages at different levels. So, for example, at the level of the house officers, the total number of posts are 1,000. Total number of posts is 1,298. Those are posts. The number filled is 1,194, which means there are 108 vacancies, or 8% unfilled, right? The RHAs are currently in the process over the last couple of weeks and the coming weeks to interview people, to interview doctors, to fill these 104 house officer vacancies.
You're saying that throughout all the RHAs, you only have this 104 vacancies for all?
For all, that is the information.
Have not been filled?
I have, yes.
And are you aware of
house officers?
House officers, yes. And are you aware as to how many have applied, qualified and applied, and not been able to be placed?
That I don't have on me now, but I'm assuring you that the NCRHA is currently pursuing filling those, because the funds allocated for the new fiscal year, as soon as they become available, they will be filled. Northwest, Eastern, and Southwest interviews have been done, and they are filling within 2 to 3 weeks.
Okay.
Naparima.
Chair, I refer to item 01, Roman numerals 12.
12, yes.
Legal settlement.
Yes, sir.
And I know you explained that this involved CEOs, instances like CEOs suing the Ministry of Health. Does it also include citizens of Trinidad or patients or their families who have problems with malpractice activities with the ministry?
Yes.
And which vote is that captured, and how much was involved in this current year?
My information is, yes, what you are suggesting is captured under legal settlement.
Well, would you be in a position to tell us in what areas do these legal activities arise from, or in what institutions in Trinidad?
It will be across the board in all the RHAs.
So because this would provide an idea of where we have problems, in which institutions, and in which areas of medicine.
Agreed.
So would you be in a position to provide that information?
Of course I can.
Thank you.
Thank you, Madam Chair. With regards to line item 04, I'm coming down here now.
North Central
North
Regional
Central
Authority?
Regional Health Authority.
Yes.
And the allocation there of just over $1 billion, Minister. And I'm hoping that this is the right line
Sure.
to ask about the provisions being made for the special unit proposed for dealing with Zika pregnant, Zika positive pregnant
It's
women.
not, but I'll answer you. This line item, Honorable Member, has to deal with meeting the arrears to employees of the RHAs and their monthly subventions.
I'm aware.
Right? So I will answer your question, which you are burning to ask, about Mount Hope. We worked with PAHO and the head of Mount Hope to bring in more resources which arrived in this country over the weekend in terms of sonographers and equipment, and I can tell you they have been deployed and employed as of this morning to do additional sonography testing, so both machines and personnel.
Okay, and that's from PAHO. There's no allocation here from the government.
But it comes out of our PAHO vote.
Thank you.
Member for Cuba South.
Thank you, Chair. To the Minister, I see that you have an allocation under 01 Regional Health Authority.
Yes, sir.
With respect to Roman numeral 7, excuse me, vacant posts,
Yes.
$30.075 million. That in itself is a total allocation to cover all the vacant posts existing at the respective regional health authorities.
Yes, sir.
And so that in itself will give you the opportunity to hire how many people?
Well, the number of vacancies are like this. For Eastern, the information I have is that there are 435 vacancies. Is that correct? Am I calling the correct figures? Let me just make sure I'm giving you the correct figures. If I don't have the exact figures here, I will certainly get them for you.
And also under Roman numeral 3, I see you have an allocation of $2 million for community HIV program. Could you provide some details on what this entails?
A lot of this has to do with public education in the battle against HIV/AIDS. A lot of it has to do with public education.
So it has been done through what? The district health facilities, what?
District health facilities, and there's also a program called Rapport.
Rapport?
Yes. A program called Rapport, which is an outreach to educate the general community about HIV/AIDS and how to avoid it.
All right, and I see under 07, National Emergency Ambulance Services Authority.
07, yes, sir.
Could you provide us with a status report on this authority?
Yes, the authority is working, the authority is established and is working.
What is it doing?
They are supposed to provide oversight over. I answered that a long time ago.
In the interest of time, that was answered Couva South before lunch.
All right, ma'am.
Okay, so do you have another question? All right, so then can I take Shogunas West?
Thank you, Madam Chair. The school health program, audio test, hearing aid service, and eyeglasses. Do you have some kind of empirical data to inform that so that as a member of parliament, I get a sense of the exposure of the children in my area, meaning that who suffer from a deficiency in these areas?
Okay, I don't have that information with me, but it's something I can provide to you in writing.
Okay. The second question, this interest payment on this $500 million loan, I see it is desiccated this way, 4.5 million Northwest. What was this money utilized for?
Okay. This money was utilized, is actually an RHA subvention for the period August-September 2016 for both salaries and trade payables. The reason for it was part of the original subvention for fiscal 2016 for August-September 2016 was utilized to meet obligations for the first part of the 50% arrears. So we had utilized some of that to pay arrears, so we had to finance our obligations for August-September 2016 financial year.
Okay, Member Faisabad.
Minister, underline item 05, Southwest Regional Health Authority.
Yes, sir.
And I just referred to a Newsday article, today's Newsday, pregnant women and babies in danger. Can the minister confirm whether in fact there is no full-time anesthetist present at the Point Fortin area hospital? And whether arrangements are being put in place to cover that deficiency?
Just for elucidation, this line item 05 is to meet the balance of arrears to the employees of the RHAs and monthly subventions. But to answer your question, the anesthetist at Point Fortin broke his leg, as you well know, and we have since assigned an anesthetist to Point Fortin. So that article is not entirely correct.
Okay, thank you.
Member for Tabakit.
Thank you. Sir, and although you have provided under item 1 Regional Health Authority sub 12 legal settlement of about 20 million.
Yes, sir.
Does the ministry or the RHAs have medical malpractice insurance for the doctors?
I think individual doctors have their own malpractice insurance. I could be guided. Otherwise, hold on, let me just check. But does the state?
Let me assist here. When litigation is brought against any RHA, the RHA, through the Ministry of Health, would normally approach the Ministry of the Attorney General if they require assistance with the assignment of counsel to help in the defense of the matter. If a litigant is successful against the state, that is against the RHA, those settlements are normally paid from the Comptroller of Accounts via a fund set up there for settlement of all orders made against the state.
But
to answer your question, I think the answer is no. There is not any specific malpractice insurance set up.
So that a medical person, doctor working in the hospitals, can be sued directly also.
Correct.
And therefore that doctor is
it wouldn't be sued in their name as an individual.
Yeah,
and that doctor would be held, if that doctor is held liable, that liability is in their own name and their own personal liability, and that would not attach to the state.
Although they are working on behalf of the state.
Correct.
Minister, are you aware that previously all doctors who worked under the Ministry of Health before the RHA was transferred, the Attorney General was the person responsible for the settlement of all matters related to doctors? Why the doctors now working in the RHAs, when sued, have to pay the individual claims for themselves? Why the Attorney General's department or the state cannot cover them when they are working within the RHAs for the state?
Well, that's not necessarily so. It will depend on the circumstances. Prior to RHAs, according to the Constitution, that all civil actions brought against the state are brought in the name of the Attorney General. So prior to RHAs being in existence, all of the medical practitioners would have been agents of the state, and the litigation would have been brought against them as agents for the state. Now, with the development of RHAs and a separate piece of legislation, it is still the RHAs who would be responsible, but it is up to litigants and claimants to bring the action against them personally, and it would depend on the circumstances and the defense run by the RHA and the doctor together. There will be circumstances, for example, where the RHA will put in the defense for the doctor. But there may be circumstances where a doctor or medical practitioner was acting outside of what we used to call in law a frolic of their own and acting outside of their ambit.
Well, that continues, Minister. You realize that the insurance for an obstetrician is nearly $250,000 TT. So pretty shortly you will not have any obstetrician within your health service, because the insurance for us as obstetricians to practice is $256,000 per year, just in obstetrics and gynae. So therefore, pretty shortly in the hospitals, no obstetrician will want to work because they will have to pay $250,000 insurance. No, what is the state?
Well, let me tell you,
This will affect the outcome of maternal and child care.
I have actually been involved in malpractice suits as well as in your field and on the defense side, so I'm very familiar with it.
Right.
And it is something that the medical fraternity really, in my opinion, needs to take a proper look at. They've been talking for years of coming up with their own self-insurance scheme, and I think that's something that needs to be pursued. If you are acting as an agent of the state and even as a doctor practicing under the RHA system, it does not mean you carry personal liability. So let's get that clear. It will be on a circumstantial and a case-by-case basis. If you are acting, and as you would know the Bolam's test, and you're acting within what is recognized as the reasonableness and what an expert in that area would have done at the circumstances, the RHA is not going to just cut you loose and say, look, you stand on your own. So first of all, it would depend on the claimant bringing an action against you. But if you're acting as the agent of the RHA, you'll be covered.
But you see, anytime a doctor is subject to that proposition, anything could happen to them at any time. They could be sued for anything.
Thank you, member.
So, all right, I just want to bring that to his attention.
Yeah.
Thank you.
I want to ask on the vacant posts. Out of the 1,194 posts that have been filled as House Officer, Honorable Minister of Health, how many of these are held by non-nationals?
Oh, that I would not have at my fingertips. It is something I can get for you, sir.
Your team wouldn't know.
Sorry?
Your team behind you wouldn't know.
No, sir.
Oh, go
Member
ahead.
for Kamuta Mansinella.
Thank you, Madam Chair. Honorable Minister, line 09, school health.
09, yes.
Yeah, I know my colleague had requested on how the program will operate, but I'm asking how will the program be administered, whether you'll be utilizing NGOs or institutions that are familiar with the either audio or hearing or eyes service.
On the issue of audio testing and hearing aid services, we do employ the services of DRECHI. So the answer for you, especially as audio testing is concerned, yes.
To 01 Romans 12, legal
Yes.
settlement. I'm just trying to be clear in my mind. You had indicated that the claims for medical malpractice would come out of this vote. I think I heard the member for Port of Spain North, St. Anne's West indicating that there is another vote which handles this.
What I suspect this line item is, if I may help assist the minister and subject to correction, this would be the cost associated with defending the legal claims, etc. As I indicated at the outset, what can happen is when the RHA approaches the Ministry of Health for assistance, the Ministry of Health may approach the Attorney General's office for assignment of a counsel. If it's an external counsel, they will have to be paid, etc. But once there is a judgment against the state, that's covered the route I indicated, so through the office of the Attorney General. However, if it is against the RHA and the Attorney General's office is not brought in, it may very well come from this fund.
So can we, for the interest of the population, get a figure on how many claims were settled for medical malpractice, medical malpractice, in what areas, and against what institutions?
The only proviso I could see to that, I'm sure the minister would assist if he can, is, as you may be aware, in settlements, if they're not court orders, in settlements there may be some element of a confidentiality clause. So that's the only reason I could see that information not being provided. If that doesn't exist, yes.
Thank you.
Can we go on now? 010, other transfers abroad, page 220. Subhead 06, current transfers to statutory boards and similar bodies, page 220, item 004 at page 220. Honorable members, we will now move on to the draft estimates of the revenue and expenditure of statutory boards and similar bodies and of the Tobago House of Assembly. So we're going on to a new book. We're at page 161. 14, Princess Elizabeth Home for Handicapped Children. Subhead 01, Personnel Expenditure. Page 161. 001, General Administration. Page 161. Subhead 02, Goods and Services. 001, General Administration, page 161. Subhead 03, Minor Equipment Purchases, page 161. 001, General Administration, page 161. Subhead 04, Current Transfers and Subsidies, page 162. 007, Households, page 162. Honorable members, we will now move on to the draft estimates of the development program. Subhead 06, Development Program, Consolidated Fund, page 87. Item 004, Social Infrastructure, pages 87 to 89. Member for Oropouche East.
Yes, thank you very much, Madam Chair, today, Honorable Minister. I am at 002 on page 88. Page 88. I'm seeing here structural assessment of the Port of Spain General Hospital at a figure of $11 million. It's a new project.
Yes, sir.
I just wanted some information on what exactly is proposed to do with this $11 million, and to ask the minister if the minister is aware that there had been other studies, condition surveys done of the Port of Spain General Hospital. And in fact, structural assessments of the Port of Spain General Hospital have pointed to the integrity of several buildings there. And indeed, I understand there's one block there that is a block that is believed technically to be very vulnerable to collapse. so that there have been studies done on the structural integrity of the buildings already and condition surveys. And I'm wondering whether this is not another waste of money, so to speak, when several studies have been done already. So if you can explain the $11 million that you propose to spend.
Honourable Member, I'm glad you asked this question because it is a tragedy and travesty that this issue was not dealt with before. The PAHO report into the structural integrity of Central Block was actually a desk report. It was not actually a structural investigation. We are going to get a proper second opinion on the structural integrity of the existing facility, and the findings of that will guide the ministry on the way forward to the redevelopment of Port of Spain General Hospital. And let me finish the answer, please. And part of that $11 million, if it is we have to do work on the facility, we will have to decant the existing patients to another ward and equip another ward or wards. And this is what this $11 million is going to be used for.
So could I understand you that the $11 million is not for a structural assessment of the Port of Spain General Hospital?
I said clearly.
It is to decant in the event that you have to. Monies will be used from this vote.
Honourable Member, I said clearly two things. One, it is to get a second opinion on the structural integrity. I said that clearly, and to point the way forward on how to rectify the problem and also to deal with the decanting.
So I'm just want absolute clarity. So the money here, $11 million, is for a second opinion.
Good Lord.
And contrary to what is stated in the line item, it will also be for relocation.
But member, you got an answer. I think you asked that question twice, and it was answered twice. And you're just repeating exactly what the member said in terms of a second opinion.
Thank you.
All right, member for Faisabad.
On the same page, Minister, 002, special program treatment of adult cardiac disease. If I can just ask
002.
Under other services.
Under other services.
Okay, on page 88, right?
Yeah,
yes.
Special treatment of cardiac disease. Just for the $12 million spent in 2016, can you provide the type of procedures and the cost per type of procedure, the number of patients who benefited from each type of procedure?
A lot of this, Honourable Member, had to do with interventional cardiac.
Yeah, I'm sure. I don't expect you to be able to give me.
Yes.
Right? So I'm just asking, and the institution which provided the procedures and the average waiting time for a patient who would have had access to this procedure.
I'll get that to you in writing.
Yeah, and if I could just go on, Madam Chair, to 03, which is a similar inquiry with regards to the renal dialysis special program.
Yes.
Again, for that $18,767,001 spent in 2016, if we can get a list of the institutions which provided these services, the number of patient treatment cycles per institution, because some patients will go more than once, the total number of patients who benefited, and again, the average waiting time for renal dialysis in Trinidad and Tobago for such patients.
I can tell you offhand the number of patients who benefit. It's roughly around 700. And all the institutions are approved by the Ministry of Health, but I can get you that list.
Sure, I would appreciate it. Right.
No problem.
Thank you, Madam Chair. Item 007, the waiting list for surgery, and I see a significant increase from 10 million in 2015 to 21 million estimated in 2017. Could the Minister give us some idea of the current state of the waiting list? The types of surgery involved, and what can the population expect in terms of waiting times, given this kind of expenditure?
So the types of surgeries involved are cataract surgery, radiology, joint replacements, cardiac interventions, neurosurgery, hernia repairs, prosthetics, and any other procedure deemed necessary by either the Chief Medical Officer, the Permanent Secretary, or the Minister.
Could you give us an idea of the waiting times in those, in at least the four highest?
Sure, I will endeavor to get that information to you, sir. I don't have exact times.
Right. And do you have a target to say, if a patient goes to the San Fernando General Hospital, he would get a cataract operation within 2 months, 3 months, a year, 6 years?
The waiting time for cataract surgeries, honorable member, has come down dramatically, as I indicated in my budget debate, as we try to do more of these things in-house. But specifics for waiting time for each one, I can get that to you, member.
Okay, because what we want to do is have a quantifiable measure, idea to measure the benefits of this expenditure. Rather than saying we will reduce the waiting list in X.
Agreed.
We'd say we'll get it down to 1 month.
Agreed.
I think the population would look forward to that.
Member for Oropouche West.
To the Honourable Minister, 005,
005,
tissue
yes.
transplant. What exactly does this entail, and does it form part of a burns unit? Tissue transplant?
Does it form part of a?
For burns, for patients who have suffered burns and so with tissue transplant.
No,
Can you enlighten us
sorry.
on it?
This tissue transplant has to deal mainly with the initiative for kidney transplants. And I think to date we have done about 150 kidney transplants. So this vote is not for burns, but mainly for tissue transplant under the National Organ Transplant Unit based at Eric Williams.
Member for Princestown.
Thank you, Madam Chairman. Honourable Minister, with respect to line item 010, Community Outreach Family
What
Medicine
page are?
Program. We're on page 88.
Right, good.
Again, line item 010 under other services, Community Outreach Family Medicine Program. Can you give us an idea of how this program functions? By the name itself, Community Outreach, what are the target areas that are being looked at, and what sort of services will be provided under this type of program?
Okay. Honourable Member, under this program, for 2016, it had to deal with the procurement of a mobile blood unit to go into the communities for members of communities to donate blood. So that will be done. Going forward in 2017, these monies will be used for dental upgrade, a dental upgrade program in the primary healthcare centers.
Member for Shogunas East.
Thank you, but my question is dealt with in 007.
Okay, member for Caroni East.
Sub-item 001, medical equipment upgrade. Minister, could you just indicate to us what that medical equipment upgrade is going to be and where?
Medical equipment upgrade.
Where is it going to be situated?
You're going back. Okay.
No, page 88.
Page 88.
Right.
001.
001. 001, page 88.
Medical equipment.
Let me just find it here. Right, medical equipment upgrade. We had purchased under the NWRHA 12 CTG monitors. We procured instruments for eye operating theater, pathology lab, for ERHA 3 ambulances, for Southwest 6 portable X-ray units and ultrasound units, lab equipment, NCRHA portable ventilators, procurement of lab equipment for Eric Williams, and going forward, we have other new equipment to procure for service delivery areas such as operating rooms, wards, clinics, health centers, diagnostic services.
Machine is going to be obsolete, and you're going to be bringing in a new linear accelerator. Where is that in this?
It's under a new line item, Honourable Member.
Could you give us an idea of the cost of that new linear accelerator for treating
I
cancer?
can't give you that cost as yet. There was an allocation to actually do the preparatory work for that.
All right, thank you. And just one more, Madam Chair. The renal dialysis, 24 million. You have now, you partnered with private sector to do renal dialysis in North and South. 100 patients, I believe, per in North and 100 in South. Where are you in relation to that? And would this 24 million be incorporated as part payment to settling that and so on?
Well, the figure I gave for dialysis is around 700.
That you're doing now?
That we are doing now, currently.
Right.
Yes.
So that 100 from North and 100 for South will be incorporated in that new renal dialysis center, in those 2 centers. You know what I'm speaking?
No, the new centers, are you talking about this? All right, I understand where you're coming from now. This This vote for renal dialysis is not for the construction of new centers. It's to pay for ongoing dialysis services of these 700 people at the approved centers.
Right, but when these two kick in,
yes,
what do we expect them to start this year?
No, the construction was stalled for many years, and we have restarted construction at both North and South.
And last question on dialysis. Do you have an idea, an estimate about how many patients requiring dialysis on an annual basis? I know you're providing care for 700. How many people require dialysis?
I will have to get that for you, but the burden of NCDs is increasing.
It's very high, very high. It's about 4,000.
Can we go on to page 90? Is that included in?
All right, so can I now call?
No, I'm sorry.
Item
90.
005, multi-sectoral and other services, page 90. Member for Oropuch East.
Yeah, thank you very much. Minister?
Yes, sir. Yes, member.
I'm seeing here at item 234, hospital refurbishment program, and an estimate of 40 million. Could I ask what would be the 40 million spent on, which would be the priority in terms of refurbishing?
Excellent.
And,
sorry?
Before you say it's an excellent question, let me ask the next part of it. It may not be that excellent. And whether or not the ministry will be paying the CPEP contractors who worked on refurbishing the hospitals over the past 2 years. And to ask you, Minister, whether you're aware that on coming into office, when you went to Mount Hope to open the ward there, and praise the good work, it was really the good work of CPEP in refurbishing the wards at Mount Hope.
Thank you.
An excellent question, I think.
For 2016, we supplied a medical vacuum pump for the operating theatres at Port of Spain. We procured an UPS system for St. James, supply of equipment at the main kitchen for St. Anne's, electrical works upgrade at St. Anne's, at ERHA, installation of medical gases at Ward 4, South RHA, renovation works at the Point Fortin Health Centre. But what is really key moving forward for under hospital refurbishment, again, it was a travesty and tragedy that the last Southwest Regional Health Authority Board paid no attention to the maternity wing at Southwest. This administration, this Minister of Health, and this Southwest Board have allocated funds for the building of a modern maternity wing at the San Fernando General Hospital. For NCR, so that is part of where the funds are going to be used. North Central Regional Health Authority, completion of refurbishment of wards 18 and 20 at Eric Williams Medical Sciences Complex. So those are some of the reasons why we have this vote.
Member?
Payments to CPEP contractors building 18, 19, and 20 of the third floor at Mount Hope. You opened it with great praise, and it was the CPEP contractors.
We are awaiting the contracts with the service providers to process payment, and that is what we are currently waiting on. The procurement process for that left a lot to be desired, and we are trying to fix it.
Member for Faisaban?
Okay.
Yeah. Thank you, Madam Chair. I just wanted to clarify a point, if I may, Chair. With regards to the maternity services, I just wanted to indicate to the Minister that consideration was given to the maternity department, but there was the need for the patients to have access to the new teaching hospital, and that would have been the reason why the work was delayed.
Where are we? What item, member?
With regards to the hospital refurbishment program.
Yes. Okay, point noted.
It's a statement.
Point noted. Infrastructure Development Fund, page 293. I am sorry, you're under item 005?
Yeah, 005, yeah.
Yes,
Thank you, Madam Chair. Early construction management cost, RHAs. What is this about?
005, what page?
005 242.
What page?
90.
24.
242. Early construction management costs. There is no allocation, but what is that about?
242. Oh, yes. This line item is no longer relevant as the ministry is funding on these under specific projects. So this line item is really no longer relevant.
A follow-up question, Madam Chair. So when is the early construction management cost of the Chaguanas Hospital facility be put in place?
Chaguanas Hospital? Or the Chaguanas Health Facility? Okay. My information from NIPDEC is that they want to relook at that project, and that is where that project is now, but we are committed to building the project.
It's the fastest growing area in this country now, Chairman.
I concur with you.
Line item 250.
Yes.
The Health Services Support Program, which is a new project. Can you give us some light on that?
Sure. This is all part, again, member, of the NCD program. So this HSSP is designed with a focus on preventative health care and strengthen the delivery of primary health services to deal with challenges being experienced in the health sector. Part of our remit coming into office was to strengthen primary health care. So a lot of this is used there.
Can you indicate how long it will take for this program to roll out or be completed?
This program has a 5-year life cycle to be rolled out starting in the last quarter of 2016.
Thank you.
Member for Oropuchis?
Ma'am, I'm going on to page 293. Are we there?
No, not as yet.
Okay, well then keep me in mind.
Member for Caroni East.
Page 90, Minister, under line item 250 Health Services Support Program, could you tell us where the support program from Johns Hopkins University on the diabetes program and the cardiac program, where are they located now? Because they were health services support program from Johns Hopkins with the cardiac, training people in cardiac care, and the diabetes program. There were two programs with Johns Hopkins.
I'm getting that information for you. My information is that program was funded under MTES through the former Ministry of Tertiary Education, and it does not fall here.
Thank you. Appreciate it.
Member for Chaguanas East.
Thank you, Madam Chair. Minister, in terms of the support services program,
yes,
could you indicate to us what is happening with the 3 floors that were allocated to the San Fernando Teaching Hospital, please?
Okay. First thing to realize is that that is a misnomer. The San Fernando Hospital is not a teaching hospital. There are students from UWI there, but no teaching takes place. If you are referring to the top 3 floors currently under UDCOT's control, we are trying to manage that situation between the UDCOT and the Ministry of Health to get access to it.
Will there be any consideration for teaching of medical students at that facility on the floors?
That is something I am actively looking at.
Is it correct to say that one of the floors out of the 3 has now been taken and allocated to the Human Resources Department of the Southwest Regional Health Authority?
I am not aware of that. But that has nothing to do. That has nothing to do with the HSSP loan.
Member for Oropuch East.
Thank you very much. Is the minister saying that the floors, the ground floors at the San Fernando Teaching Hospital, the Chancery building, that those ground floors with facilities, classroom facilities and lecture room facilities, they are not there for the purpose of teaching or education?
I said it was a misnomer to call the facility a teaching hospital because although there are students and they may have facilities for teaching, no teaching takes place. And further, that does not fall under line item 250 and Health Services Support Program.
And would the minister tell us why no teaching is taking place at a teaching facility?
You need to ask yourself.
Remember, Infrastructure Development Fund, page 293, item 004, social infrastructure. Member for
item on page 90, we still had...
Page 293.
You didn't go to G.
293.
which is equipment and vehicles purchase of a
Infrastructure Development
Lord
Fund,
Jesus.
page 293, item 004, social infrastructure.
Thank you. Madam Chair, I have 5 questions in this area. Could I ask all 5 one time?
No, I suggest it as them one
Ask
at a
what?
time, please.
Thank you very much.
Good.
First, I wanted to ask the Minister, the actual for 2015 is 423. The estimate for 2016 was a bold 616 million, revised down by over $200 million to 402, and your 2017 estimate is 261. I wanted to ask specifically why the revision downwards and how much money exactly was spent in 2016 if we are to realize what was spent when $616 million were available and you revised downwards less 200 million. What was actually spent that the Ministry of Finance will now estimate you at $261 million? My first question.
Honorable Member, the simple answer is this. Many of those projects in 2016 were at a very advanced stage of completion.
Oh, thank you.
And significant payments were made in 2016.
You're
Therefore,
welcome.
the same quantum you would have needed in 2016 will not be required in 2017.
Great. Thank you. Thank you very much, and you're most welcome. The other question relates to the Arima Hospital. I can go there. Could you give us an update on what exactly is happening with the Arima Hospital? Has the government awarded the contract? This is, I believe, a loan facility with the Chinese government. What stage of construction are we at, and when do we expect construction to be completed?
The Arima facility, the Arima Hospital, the allocation this year, and this is one of the line items, is $70 million. Work continues at the Arima facility.
Work continues. Minister, on the Arima facility, it is a loan arrangement with the Chinese government. What is the $70 million for? Minister of
Madam
Health.
Chairman, to the member for Oropouche East, the loan arrangement was not finalized prior to the election. There are all sorts of issues with it, including the absence of a proper framework agreement. And this has become very complicated. As a result, the Ministry of Finance has decided to fund the continuation of the construction out of general revenues until we sort out the hornet's nest that you left for us.
Does the minister have a timeline when the hornet's nest will be sorted out, given that you claim you're cash-strapped, you're using money from the consolidated fund, from the Treasury, and you are yet to finalize the arrangements with the Chinese government for which loan financing is available for this project?
You did not finalize the arrangements. The Ministry of Foreign Affairs has to resolve the framework agreement with the People's Republic of China, which you did not.
Madam
it is very
Chairman,
complicated. No, I don't have a time frame.
Yeah. Ask the Minister of Foreign Affairs at a later time about this
You do
matter,
that.
since it's a
You
foreign.
do that.
You'll be allowed
You come back to me. Okay, good.
Member for Carneys.
Yes, the construction of the line item 003, the construction of the National Oncology Center. 200 million was estimated to be spent in 2016, but your revised estimate showed that only 25 million was spent. What occurred? What happened there? Was it your decision not to continue, or why was the slowing down of the work on the oncology center during that year? Is it the intention of the government not to continue it?
I'll answer that. As you should know, Honorable Member, your government made a complete mess of this project, causing the termination of the construction contract with Bouygues, causing a renegotiation of that contract, causing the contract to be converted from a construction contract into a design and build contract, leaving another unholy mess for this government to unravel. So we are now at a situation where the project was not advanced during your tenure because you made a mess of it. And we now have to unravel the legal and contractual mess you have left for us. And if you want a time frame, there is none at this point in time.
No time frame.
Mr. Mancinella, and then Orpuchi.
Yeah.
Thank you, Madam Chair.
So you're obstinate.
Members, member for Carney East, please.
Honorable Minister, can you shed some further light on 007 construction of the San Grande Hospital? Why was only $1 million allocated?
Yes.
That's the first question.
This is to finalize the user brief to inform how we are going to tender for this project.
On a related question.
1 minute, please. Anybody else? Member for Orpuchis.
A related question, which is not part of my original questions. The San Grande Hospital, could the minister just direct us to the report or study which recommends the construction of a San Grande Hospital and what bed capacity is being recommended by the technical report that speaks to this matter?
And that is why I said we are going to look at the user brief, which will encompass all of that. But one just has to walk through that facility to know that you need a new facility there.
Okay, so I'll accept that. You just walk through the hospital to know you need a next hospital.
Member for Orpuchis,
My next
I believe
question.
you have another question.
Yes. Could I go on?
Please.
Yes. Thank you. The same series of questions concern the Point Fortin Hospital, the status, and particularly in this matter, Minister of Health. I want to ask the outcome of any attempt in the last year to renegotiate this contract and to change the original scope of the contract with the contractor in Point Fortin. Could you give us an update as to what work is being done, whether the contract has been renegotiated, whether the scope has indeed changed, and whether there have been implications for costing of this facility, and when can we expect the completion of the Point Fortin Hospital?
Just to go back briefly to flesh out the San Grande issue, part of the decision to build a new San Grande Hospital was coming out of the Welsh report.
The Welsh report?
The Welsh report actually recommended that. I just reflected on that.
So it's not to walk through the San Grande.
So the Point Fortin Hospital completion date is March 2018, and there was no renegotiation.
Did the scope change in terms of the bed space and capacity of the Point Fortin Hospital?
To the best of my information, the scope remains the same.
Okay, thank you. Another question. Just for the record, Mr. Minister, could I just ask the San Grande Hospital, have you found a location as yet? Have you identified the lands which will be used for the San Grande Hospital?
Not as yet.
Not as yet. Okay, thank you.
We are in the initial stages.
Sure. No. The Children's Hospital, could I ask the Minister, just for the record, if the Minister has made any official visit to the Children's Couva Hospital in the first year in office?
Which line item are you referring to?
The Couva Children's Hospital.
Yes.
100
Have I paid a visit?
$18 million.
The answer is yes.
Thank you very much.
Okay, can we go on? Item 005, multi-sectoral and other services, page 294. Honorable members, the question is that the sum of $5,506,381,330 for head 28, Ministry of Health, stand part of the schedule. Those in favor say aye. Aye. Those against say no. I think the ayes have it. The sum of $5,506,381,330 for head 28, Ministry of Health, now stands part of the schedule. I'd like to thank the Minister, his Permanent Secretary, and other technocrats. Have a good evening. You all are relieved. Head 78, Ministry of Social Development and Family Services. And while the technocrats take their seat and the ministers, members, we are going on to page 568 of the draft estimates of the current expenditure. Head 78, Ministry of Social Development and Family Services, $4,755,638,165. I will now invite the Minister of Social Development and Family Services to make a brief opening statement, not exceeding 5 minutes. Honorable Minister.
Thank you, Madam Chairman. The main aim of government social sector policy is to reduce poverty and improve social justice with the objective of achieving a more stable society. In this regard, the Ministry of Social Development and Family Services mandate is to address the social challenges of poverty, social inequality, and social exclusion, and to provide a safety net for the nation's poor and vulnerable. The Ministry's focus in 2017 will continue to be on developing, implementing, and administering programs and services to enhance the quality of life of vulnerable and marginalized groups such as persons with disabilities, the elderly, poor and indigent, socially displaced, and persons living with HIV/AIDS. The imperative for the Ministry during 2017 will of necessity be doing more with less. For even as Trinidad and Tobago is forced to adjust to the straitened economic circumstances, the Ministry continues to have a sacred responsibility to the poor and the vulnerable. As we address the issues of social inclusion, social development, and social empowerment, we at the Ministry will therefore be guided by 4 parameters: duty of care, quality of care, living within our means, and correctly determining need. The Ministry has received an allocation of approximately $4.8 billion, which is approximately 9% of the budget. And we know that the total allocation to the social sector is just about 20%, which is in keeping with international standards for social sector expenditure, and is a clear demonstration of government's commitment, despite the economic circumstances, to safeguard the nation's vulnerable. Thank you, Madam Chairman.
Honorable members, the question is that the sum of $4,755,638,165 for Head 78, Ministry of Social Development and Family Services, stand part of the schedule. Honorable members, the sum of $4,755,638,165 for Head 78, Ministry of Social Development and Family Services, is comprised of monies proposed for expenditure under the following subheads and items to be found in the draft estimates of recurrent expenditure, the draft estimates of the revenue and expenditure of the statutory boards and similar bodies and of the Tobago House of Assembly, and the draft estimates of the development program. We now proceed to consider the draft estimates of recurrent expenditure. And we go to subhead 01, personal expenditure, page 568, item 001, general administration, page 568, member for Kamuto, Manzanilla.
Thank you, Madam Chair. Honorable Minister, line item 01, salaries and cost of living allowance. I notice there is a significant decrease in salaries. Can you indicate what is the reason for the drop?
Honorable Member, in 2016, the Ministry would have been required to make arrears of salary payments, and that would have accounted for approximately $3 million. So that is what would have been responsible for that great increase, and in 2016, we would have spent approximately $15.4 million. So if you look at the estimate for 2017, it is in keeping with that amount.
So therefore, it does not reflect staff being not brought back through contracts or being dismissed?
No, this figure has nothing to do with staffing.
On line item number 606, remuneration to board members. Can you indicate why was there such a decrease in remuneration? Was it that any of the boards were disbanded?
No, what has happened is that this allocation has not been utilized over the last 2 years. And this does not relate to payment for the public assistance boards.
That's it?
Yes.
And the 08 vacant posts without incumbents. I remember you stated in your budget statement that there were 130-something plus persons that were received cabinet approval. Will any of those, will that request come in this in 08 at all? I see you have 800,000 dollars.
No. This doesn't relate to contract employment. This is specific to the establishment, public officers.
And will you be hiring anyone in those positions?
We have asked the Service Commission to proceed with advertising and filling these vacancies, so we await feedback from them.
So they were already advertised for?
Well, we have asked them. I'm not sure if they would have already advertised.
I'm aware that they were advertised and that there's a huge number of requests that come in. And it's being processed by the ministry, not by...
No, this is not contract positions that the ministry treats.
No, it's not contract positions I'm referring to. But
so these are being handled by the Service Commission, not by the ministry.
Member for Couva South?
Yes, sir. Okay. On a point of clarification, the minister said that these are posts within the establishment, right? How many vacant posts are there that are going to be filled? And what are the classifications and so on?
There are currently 50 vacant posts. But would it be okay if I give you that subsequently, because I have it here, but it's quite a number.
Okay, so the $800,000 will cover all these vacant posts on the establishment.
We expect that it would, given that they would be filled on a phase basis.
A phase basis?
Yeah.
Okay.
Member for Kumucha Mansinela?
Would the shortage of staff create the services to be diminished in any way or affected?
No, we do not expect that to happen, because what the ministry would have done, we have utilized contract employment or short term in the interim.
But, Madam Chairman, through you, Honorable Minister, I do believe that the services have been restricted in many ways because of a lack of staff.
I do not agree.
It's not my opinion, it's what is happening on the ground.
Ma'am, Kamucha Mansinela, you gave up a position, the minister doesn't agree. Do you have another question?
We could go on from there.
Okay.
One more question on this line item. Number 14, remuneration members of cabinet. Could you advise why there was a drop in the estimates? Is it that any of the committees were stopped?
There isn't a drop in the estimates, but what has happened is that there are 17 committees, 14 of which had not been functioning over the last 2 years or so. And these are the regional social human development councils that are supposed to operate under the poverty reduction unit. So that is why you would see that the actual expenditure would have been approximately 43,500, and that the allocation is the same.
Would the Honorable Minister submit in writing the various committees that were non-functional, please?
Yes, that will be submitted.
Item 003, social welfare, pages 568 and 569. Item 004, Gender Affairs Division, page 569. Item 005, Child Development Center, page 570. Member for Kumutu Mansinela.
Thank you, Madam Chair. Honorable Minister, Line item 01, salaries and cost of living allowance. Is it that I understand that a number of these child development projects went across to the Office of the Prime Minister? Is it that the Ministry of Social Development and Family Services are providing the salaries of those institutions that have gone across to the OPM?
This item deals with the Interdisciplinary Child Center at Couva. We would have requested that it would have also gone across to the Office of the Prime Minister, but it has not happened as yet. So this is why provision is made here for it in the budget. But all of the other items related to children would have gone to the Office of the Prime Minister.
Is there any particular reason why you requested that this particular item remain with you?
No, we did not request that it remain. It's just that it has not been moved across to transfer to the Office of the Prime Minister just yet.
Okay, thanks.
Item 006, National Family Services, page 570. Subhead 02, Goods and Services, page 571. Item 001, General Administration, pages 571 and 572. Member for Princeton.
Minister, I've seen a decrease under line item 16, General Administration, with respect to contract employment, and it's been a cut of 4 million. Can you indicate to us, and I know you may not have the information at your fingertips, but if you can provide us with the positions that would have expired, positions that would have been discontinued, positions that would have become redundant, since you become minister, that would account for the decrease in the 4 million over the last financial year, what you project will be those in this coming financial year.
Honourable Member, we have not projected any changes per se to the contract employment. We have a number of positions. We have 839 contract positions, 667 of which are vacant and 172 which are filled. We have not proposed any reduction in those numbers.
Okay, Minister, but then how do you account for the calculations with a cut in 4 million?
The initial amounts allocated in 2016, 4.1 million of that would have been with respect to gender affairs, and gender affairs have since gone under the Office of the Prime Minister.
Okay, all right. And Madam Chair, through you to the Honourable Ministers, we are on the issue of employment, line item 22, with respect to short-term employment. This is a huge decrease of over, what's close to 18 million. Can you give us an idea again in terms of what positions are being discontinued, what positions have expired from the last financial year that we will see similarly in this financial year being discontinued or expired or restructured?
What was supposed to have happened is that there was a projection that a number of these short-term positions would have been converted to contract. So we would have made the request for the necessary allocation. However, we have not seen it reflected here.
Okay.
Okay. So this reduction, the amount that has been allocated, if we continue with the number of short-term employees we currently have, would not be adequate, and it would be necessary for us to have some sort of allocation adjustment at the midterm review.
Minister, based on your own assessment, what you have just indicated, it seems that your ministry is severely under-resourced in terms of personnel in that case. And how do you manage over the next few months before the mid-year review in terms of providing these services to the people of Trinidad and Tobago?
On the contrary, the ministry is not currently under-resourced. What is likely to happen at the end of the 6-month period, we may need to have a further injection of revenue. But at present, we still have the numbers that we have been working with.
Certainly. Minister, as you would appreciate, especially coming in as a new minister, that sometimes in the public service, things take a little bit longer to get to where you want it to be. And if you are saying that within 6 months, when we come to the mid-year review, that some of these things will be determined, will be sorted out by then, really, I think that is putting the cart before the horse, in that you're hoping that these things will come to fruition, that you will be in a better position then to deal with the administrative issues when it comes to the human resources. But in truth and in fact, that in itself will take you some time as well, because then you would have to go through.
Question is,
In the short term, Minister, what is your plan going forward with respect to your human resource capital within the ministry?
Member for Princeton, as I indicated previously, we would have made a request for allocation to cover the numbers that we require. During fiscal 2016, we would have spent approximately $34 million. We have been allocated 17, and that is why I would have indicated that by the midterm review, we would be seeking to have an adjustment. Obviously, we would not wait until then. We would have already indicated what our needs are, and we will continue to pursue it.
Member for Kamuto Mansinella.
Honorable Minister, with the reduction in contract and the short-term employment, could you tell me how many field officers were impacted upon in this reduction?
Which reduction?
With the decrease of short-term employment, the allocation, as well as the contract, how many field officers were in fact affected by this decrease?
Honorable Member, as I would have indicated before, we have not reduced our numbers under this general admin. We have not reduced our numbers. Where the reduction has taken place is in the budgetary allocation. And that is why I would have indicated there is going to be need for an adjustment at the midterm review if we continue with our current numbers.
So therefore, the figure of 400 plus persons that you indicated in 2016 budget, not 2017, 2016, where you indicated that the staff, the ministry was overstaffed by 400 something plus, is in fact incorrect if it is that you are adequate to this day.
Member from Kamuto Mansinella, I believe you asked a question under short-term employment.
Yeah, it has short-term employment.
Okay, and an answer was given with respect to that. So that I'm not sure that the question you're asking relates to that at all. I will now take Kuva North.
Thank you, Chair. Through you, number 8, rent, lease, office accommodation and storage. There's a sharp decrease by nearly 7 million. Can you give clarification for this, please? 08.
Okay. What would have happened? This allocation in 2016 would have provided for 1 Alexandra Place, because in 2016 it was anticipated that the ministry would have continued in occupation at 1 Alexandra Place. We stayed there approximately for 2 months, and what would have happened, we would have made provision for, I think it was approximately $6 million to cover the rental for that 10-month period. So that is why there is that sharp difference.
Member for Tabaki.
Honourable Minister, you said that you will go back to the midterm budget to review the number of persons you will want. So is it that you are already projecting that you will
Member for Tabakit, I'll stop you because I have been sitting here, I have not heard the minister say so.
Okay. Minister, are you understating the real budgetary requirements of your ministry by not reflecting what is the true amount of money you will have throughout the year? Because I notice it's a consistent pattern in other ministries where every time we ask a question, they say we're going to go back to the midterm budget and there it will be raised. Are you understating what the real budget is?
I don't think that... Tabakit, I sat here earlier today and I would have heard the honorable member, Minister of Finance, indicate that ministers would not have made reductions in their budgets. They would have provided estimates and the Ministry of Finance would have made the adjustments.
So the ministry,
I did not underestimate.
The ministry has taken a deliberate strategy, would you say, to understate the budget and therefore not...
And member for Tabakit, I would not allow that question to the Minister of Social Development. Member for Oropuch West.
Thank you, Madam Chair. Honorable Minister, line 40. I'm seeing $800,000 is allocated. It's a new sub-item. What does this entail, Honorable Minister, and what institutions are targeted? And what is the criteria used to supply food to these institutions?
This allocation is intended to provide 3 meals per day to 100 persons that are housed at the Piparo Center and New Horizons.
Yes, Madam Chair. Just want to return to 16 and 22 on contract employment and short-term employment. With the reduction under short-term employment or the decrease of $17,982,000, what does this mean? Any units or divisions of the ministry has been disbanded or will now become defunct? And with respect to contract employment, I just trying to clarify how the ministry is operating with a reduction of $4 million. Is there any worker or numbers of workers who would have been dismissed at the Ministry of Social Living?
Honorable Member, in terms of these 2 line items, as I indicated before, with respect to the contract employment, $4.1 million was budgeted last year for gender, which is no longer under the ministry. In terms of this...
That's line item 16?
16.
So, so as a result of that, the gender division being no longer there means that your wages have been reduced by $4 million.
Yes.
Okay.
And in terms of the short-term employment, as I would have indicated, in terms of general admin, we have not reduced the short-term staff there. This provision is what was approved at this point in time for the ministry. We recognize that given our numbers, we would need to adjust this at some point, and we would have indicated that that is likely to happen at the short term.
So job cuts are coming at the ministry.
Member for Couva South, I have been extremely patient. The particular question you've asked, I have sat here and I've heard it asked 3 times.
Speaker, I have been very patient too. So.
And so have I been. I think my patience is exhausted. We have a lot to do. And I would ask people to kindly pay a little more particular attention. Okay? Maybe what you want to be answered is not what you're asking. And I will allow you to ask what you want to ask, but you have to frame the question.
Well, I'll be very patient. And
Thank you, Madam Chair. Honorable Minister, the line item 08, rent lease, is new premises for the ministry included in this estimate at all?
No, it isn't.
Will it be in another line item for where the head office is?
I think it's under the development program.
Okay.
Item 002, Division of Aging, page 572, member for Naparima.
Did I? I didn't ask. But since I'm on the
Chairman
floor,
is looking out for you.
Since I'm on the floor, and I'll come to it later on the next page. So I want to reserve the right answer on section 4. I get this sense that there's something against the senior citizens of this country. I see. Could you just clarify? There's no allocation. Is it allocated somewhere? I'm pointing to 002.
Okay. Yes, line item number?
002
yes,
on page 576.
Yes.
Can I take it that this has been...
You jump, right?
All right, I jump.
We're on page 572.
I'm old and sprightly.
Madam Speaker, if I might just interject here, please, in direct response to Naparima. Naparima, when I spoke on the homes for the elderly, I gave the undertaking that this government will take good care of you when you need to.
You see, but I don't trust you.
Members. I think we all know sufficiently awake. All right, so can we go on? Member for Kumuto Manzanilla.
Thank you. Thank you, Madam Chair. Honorable Minister, again, line 16, contract employment, there is a decrease. I'm just wondering, going now to 05 telephones, if there is a decrease in Well, I would assume there's going to be a decrease in staff. Why is there such a huge increase in telephones? Almost 5 times higher. Yes,
500 Division of Aging. Telephones.
What is proposed, we are looking at bringing on inspectors 1 and 2. And we anticipate that there's going to be an additional need for the use of the telephone. In addition to which, in 2016, when we started off, the Division of Aging was housed elsewhere. And they're also looking to get new accommodation, so we anticipate they are likely to need additional telephone resources.
Madam, thank you. The inspectors, would they come under line item 16, contract employment?
Yes, they would.
Although there's a decrease?
Okay, yes. In 2016, we would have spent approximately $900,000. And we have been given an allocation of $900,000. And we anticipate that this should be sufficient to take us through.
Item 004, Gender Affairs Division, page 574.
574, 573.
Yeah, but I stopped and I waited and I saw nobody. So, item 0. Oh, I'm sorry. Item 003, Social Welfare, page 573. Member for Shagona Seas.
Thank you, Madam Chair. Item number 22, short-term employment, had a very large decrease. Could we get some information as to why that is so?
Okay, during 2016, we would have had 115 persons employed on the biometric project. And that project was placed on hold. As a result, we would not have had the need for the 115 persons going forward.
Through you again, what's the status of that project, Minister?
That project is currently on hold. We are reviewing the project going forward as to whether it makes sense, particularly given our current economic circumstances.
Member for Kamutu Mansinala.
And the same, following on the question of my honorable colleague, Madam Minister, how does the ministry propose to be accountable for how persons spend their monies if we don't have a system in place to do so?
I don't understand the question, sorry.
How does the ministry intend to account for the spending of state funds, grants to grants, if there isn't any accountability because you have a direct deposit system in place? You can't determine if persons are buying food or anything like that. So if you remove the biometric card, what is the accounting system in place?
Honourable Member, the card is still being utilized by approximately 24,000 persons. It is just the 3,158 persons and the additional 4,555 whose card had been on hold for the last 2 years that we are currently paying by check or direct deposit. Given our economic situation and given the need to ensure that persons continue to receive food support, we had to resort to that method of payment. So it is not that it is the ministry's intention to not assist persons in ensuring that they purchase food, but given the situation, it was the best option available. And this is intended to be a short-term measure. It's an interim measure. We are currently actively pursuing the utilization of a new debit card system that would extend to all persons.
Member for Tabaki.
2 questions. One on fees. You have a fee here of $6 million. I'm wondering what are these fees for? And secondly, the amount of $160,000 for training. It's not about the amount, but a lot of constituents of mine in my constituency actually come to the office crying because of the manner in which they are treated by some of the officers. One particular officer, whom I now believe you have transferred, I want to know what kind of training is being given to the officers, so that when they go out, and I really mean that, they come and they cry, right? I wish I could state the name of that officer here in this Parliament.
But you know you won't.
I wouldn't. I wouldn't. But I'm telling the minister, and this is a very serious situation. Your officers are sometimes uncouth, they're unfriendly, and sometimes they start from the point of view of how do we take it? What are you doing to train and retrain and sensitize these officers to their jobs?
No, two questions. It's fees and training.
In terms of the fees that are stated, these are payments, these are fees paid to the National Insurance Board because they are responsible for the checks. PTSC, all persons over age 60 are provided with free transport.
Excuse me. Member for Couva South, I feel this information might be something that might pique your interest. Member for Couva South. Continue, please, Minister.
And the two TT posts for the distribution of those checks.
Okay.
In terms of training, as I would have indicated in my budget presentation, we recognize that while our suite of benefits are excellent, the service provided at times is not of the best quality, and so we are embarking this year on introducing a customer care quality service program throughout the ministry. And the first persons to be targeted and trained are persons that interact directly with the public.
One follow-up question. If an elderly person who is in receipt of a pension happens to be invited by a family member to visit Canada or the United States, and the officer comes and looks at the passport and said, you have traveled, and therefore I now have to verify whether you should continue to get your pension. Is that reasonable? And the person stayed for a month overseas.
And a question, but under what head are we?
Under the head of training. No, it's just because they are trained to do evaluations. It's a prejudicial evaluation. This happens, huh? This happens.
So what you're asking really is the sort of factors that go into the evaluation for qualification.
Yeah, and how, whether these are being applied arbitrarily. I mean, anybody could invite a grandmother or somebody to come overseas, and you come back, and they say, but somebody report you and say, this person traveled. They didn't pay for the ticket was sent to them and everything, and yet you take away their pension or you withhold their pension. I think all the members here have examples of that.
Honorable Member, there are policy guidelines that we operate by, and persons in receipt of the senior citizen pension, when you leave the country, your pension is placed on hold. When you return, your payments are reinstated.
Well, I never knew that.
All right. Member for Caroni Central.
Madam Chair, through you to the Minister. Item 22, short-term employment. In view of what you said, Minister, about the biometric card and a number of people being basically sent home or being displaced, and given the reduction here in the allocation of about $5 million, how many people are we talking about who have been sent home?
The numbers that would have been reduced by is 115, but I think it is important to understand that the biometric project, the intent was never to employ those persons permanently.
Yeah.
It was to have the project up and running. Okay? So this 115 is not that they were displaced or they were sent home. The period for which they were employed would have come to an end. So you would have had them leaving in two tranches. In June, the main aspect of the project came to an end, and those who remained would have been those who would have been supporting those who had been transitioned to the system. And given that the project is now on hold, those would also have been, when their contracts came to an end, they would not have been renewed.
I may be wrong, but I think I heard you also to say that this does not mean that other people will not be hired on short-term contracts. Am I correct or no? I wanted to ask you if the people who have been sent away now will be reconsidered in any rehiring of people on short-term contracts, is what I wanted to ask.
persons are normally hired on short term to fill a need. For example, somebody goes off on leave, maternity leave, or what happened over the last period was abnormal in the sense that short-term employment was utilized to fill positions that would normally have been filled by persons on contract. But the definition of short-term employment is really intended to be for 3 months, maximum 6, for a specific period to do a specific task or fill a specific need. So once the ministry has those needs, it will look to persons, and your first course of action should really be persons who would have been employed before, who understand the ministry and understand the system if you need them for a short period of time. But in terms of contract positions, we have advertised those positions externally, and they are all free to apply.
Okay, item 004, Gender Affairs Division, page 74. Item 005, Child Development Center, page 574. Member for Kumutu Mantinala.
Thank you, Madam Chair. Honorable Minister, line item 17, training. With the Child Development Center, for what you have here in Cuba, is it that this would be adequate? That's why you, there's a decrease?
I believe it would be adequate.
Item 006, National Family Services, page 575. Kumutu Mantinila.
Thank you, Madam Chair. Honorable Minister, can you again explain 01, the reduction in the decrease in travel and subsistence allowance, and how will it impact upon employees who would need to travel? Or would they not need to travel?
In 2016, we would have paid arrears on traveling and subsistence. So that is what account for the decrease here, because we do not need to pay that this year.
Item 007, Disability Affairs Unit, page 575, member for Princestown.
Thank you, Madam Chair. Honourable Minister, if you'd indulge me with respect to the Disability Affairs Unit. I note that the program that existed prior to you becoming Minister with respect to cerebral palsy, children inflicted with cerebral palsy, has been removed. It's been a contentious issue. My question really is whether or not the Disability Affairs Unit has been undergoing, under your tenure, any change management with respect to any research that has been done in terms of what are the conditions that most affect persons that apply for disability. I have seen recently that one independent senator who is disabled himself have indicated that the Disability Affairs Unit under the ministry seems to not be providing for the actual needs in terms of the amount of persons affected with cerebral palsy. Would you be in a position at this time to indicate whether or not your ministry, through this unit, is going through that change management process to actually do the research to see which areas of disability most affects persons in Trinidad and Tobago? I know in my constituency in particular, I've spoken to you on several occasions, and you have been helpful with this, but I'm particularly looking at the area of cerebral palsy in terms of what is government's policy, in terms of assisting children, especially in terms of dealing with cerebral palsy, but also looking at the change management aspect of the Disability Affairs Unit in terms of targeting the areas that really need more specialty attention.
What I can say to you, Honourable Member for Princestown, is that the Disability Affairs Unit continues to do a lot of research into all aspects of disability. I have not of myself seen a report specific to cerebral palsy, but I know it is something that we have been looking with because we have met with both associations, and based on some of the submissions they have made, we are looking at it with a view to how do we move forward. In the interim, the ministry makes provision for the special child grant, and so in that way, at least those children have something that covers them currently.
Are we under like sub-item 012, 10, 11, 15, 62, and 66.
Just a follow-up to Minister's comment. Minister, could you indicate whether or not the ministry, in its current dispensation, is preparing a work plan with respect to identifying some of these research methods and mechanisms that you have identified in collaboration with some of these organizations? A work plan and schedule, and if there are timelines in terms of coming up with a work plan and actually putting it into effect?
Yes, work plans are being developed by this Disability Affairs Unit and our Social Investigation Unit.
Would you be able to be in a position to give us some sort of guidance in terms of timelines that you're looking at? As you would appreciate, it's important that we look at timelines in terms of delivery.
The work plans are supposed to be completed by the end of next month, and the work plans span 1 year.
Member for Kamuta Mansinalong.
Thank you, Madam Chair. Honorable Minister, I heard you indicating that you met with the cerebral palsy. Could you tell me when it is you met with them, please?
It is difficult to give you specific dates, but I can provide you with that subsequently.
Thank you.
3, minor equipment purchases, page 576, item 001, general administration, page 576. Item 002, division of aging, page 576. Item 003, social welfare, page 576. Item 005, Child Development Center, page 577. Item 009, National Family Services, page 577. Item 007, Disability Affairs Unit, page 577, member for Caroni Central.
Yeah, I know that the minister on some earlier occasion indicated that there were problems with the unit in Carlson Field, I believe, having to do with cerebral palsy, or was it a disabilities unit there? And that some renovations or some adjustments had to be made. But I can't remember ever you given a date for when it could become functional. Do you have an idea?
That comes under development program, but apart from that, because of the number of problems encountered, it is difficult to give a date at this point in time. Currently, we are waiting the approval of the City Corporation and the Tongue and Country Planning before we can move forward. In addition, Ministry of Works would have also raised issue with the structural integrity of the building. So we needed to go through all of those processes before we can commence some of the remedial work that needs to be done internal to the building.
Subhead.
It's not likely to be done in this fiscal year.
Yes. Fiscal 2017, yes, most certainly. We were hoping, we thought we would have been able to complete it by the end of calendar year 2016. But given all that was encountered, that is not possible. But we expect to have it operationalized during this fiscal.
Okay.
Subhead 04, current transfers and subsidies, page 578. Item 003, United Nations Organization. Item 005, non-profit institutions, member for Naparima.
Thank you very much. Thank you very much, Chairman, and to the Honourable Minister. Notwithstanding assurances of a future good life given to me by the member for Aruka Maloney, I get the sense everywhere I turn with respect to senior citizens that it is not a priority in your ministry. In the previous page on the division of aging, there was nothing for vehicles, etc. And when I look at item 28, senior citizen homes, I see a cut, and this will not significantly affect
our budgetary fortunes. But you cut it from 1.2 to 1 million. 29, item 29, senior citizen centers. You cut that from 3.5 to 3 million. Social programs for the aging. You cut that by 1.8 million. Item 32, retirees adolescents partnership program. I understand this is where young people will interact with the senior citizens in order to have a partnership that would lead to a better life. What if I were to say that based on, and I know you have to make cuts, but the cuts, where you cut is indicative of where your priorities are and where your interests are. If I were when I wrote Common Entrance in 1962, there were 38,000 people writing. Now it is 16,000 writing, which means that the birth rate is dropping and the number of senior citizens are increasing. Why do I get the impression that you do not care for the senior citizens? Well, is my impression correct?
Incorrect.
Based on the cuts, and what is to give me an assurance that these cuts are not reflective of a particular
Honorable
predisposition?
Member for Naparima, that is totally incorrect.
Yeah.
I would have taken great pains in my budget presentation to seek to convince this House that this government is a caring government. We have to take everything within the context of our current economic situation and doing more with less. So our approach has been, based on what we would have spent in 2016, we would at least maintain that level or a little more. And in 2016, we would have spent $956,000 on senior citizens' homes. We have allocated $1 million. In terms of the senior citizens centers, we would have spent approximately $300,000. We are still
3.5 million. Senior citizen home.
No, sorry, spent $3,006,000. We are still at $3 million.
No, you spent revised estimates 2016 3.5 million.
I am speaking in terms of what we would have actually spent.
I thought revised estimates was what you actually spent.
No.
Okay.
But when there's a closing of the accounts.
Okay.
So in 2016, we would have spent $3 million approximately on senior citizen centers, and we have budgeted $3 million. In terms of the social programs, now these programs are intended to build awareness. And what I would have found is that, okay, for example, we are having a program on the Brian Lara Promenade to build awareness about senior citizens. And you can spend upwards of $400,000. We need to do it differently.
Agreed.
So we are going to be adopting different approaches that would not require as much expenditure. But we are going to continue to ensure that we build awareness among the citizens in terms of aging.
Your ministry has a policy on aging.
Yes, it does.
And is it, because the only thing I've seen is that there's going to be a classification of homes for the elderly. Is there anything that the senior citizens can look forward to in terms of tangible deliverables based on these expenditures?
Yes, in terms of they are going to continue to be provided with access to the senior activity centers. Those who need to be housed in senior citizen homes will continue to do that, in addition to which we continue to provide the free transport on the ferry and the boat to Tobago, and in terms of the public transport. So we have not cut any of those provisions.
Madam Chair, Honorable Minister, am I correct in reading that the allocation for non-profit institutions would be 9.5 million?
Non-profit, no, that's 14 million. At 31?
At 00502, I'm just reading total. These
Oh, sorry, you are over on page 578?
Yes, I am.
Right, okay. Okay, yes.
All right. Does that mean, therefore, that there's going to be a reduction for assistance towards these institutions? Were these institutions at all called in to have a meeting to discuss the way forward?
Could you particularize which institutions you're referring to?
From 03 to 24.
Okay.
Honorable Member, the other social programs referred to here are not the NGOs. These programs are in terms of, for example, under our poverty reduction programs, where we have the MEL program and we have the training for the seed grant recipients. It also deals with in terms of the operations of the New Horizon facility and the Piparo facility. And in terms of hosting symposiums, for example, like for NGOs and HIV, it has nothing to do with the subventions to our NGOs.
So therefore, the 9.5 million would provide for conferences or training and stuff like that?
Yes, and for example, when we host things on the Brian Lara Promenade, that is what this deals with.
Can you, therefore, advise what is line item 31, which would be on page 579?
Okay, 31 treats with the NGOs.
And can you identify the NGOs, please?
Currently, there are 25 NGOs, and if you wish, I would send that to you subsequently, because it's an extensive
Sure,
list.
and is it that you have determined already what they will be allocated?
Based on cabinet approvals that we have for all of those NGOs, you already know what the figures are.
Okay. There is a concern for one of the NGOs. I'm trying to find it here, but I know that the Blind Welfare has indicated that they have not received anything, and I think it's reflected here in your in your
item number.
Item.
Blind welfare, Madam Chairman, I believe would come under the statutory boards and under. But at this point, I can state categorically that that is an incorrect statement, that they have not been provided with any allocations.
Well, I'm only reading what it is I'm seeing here, Madam.
Well, remember, I think the Minister has directed you to the right place that one should look at. Member for Shogunas East.
Thank you, Madam Chair. I'm on page 579, item number 32. Honorable Minister, you would agree that we are experiencing an aging population in Trinidad and Tobago, but I noticed that you have a cut of 300,000 in this. I just wanted to ask the following. Number one, how many persons are involved in this Retirees Adolescent Partnership Program? What's the criteria to engage in this program? And what is stipend that these adolescents receive?
Honorable Member, could I provide you with that subsequently, please? I do not have that here currently.
Okay, all right.
Item 006, Educational Institutions, page 580. Member for Shogunas East.
Thank you very much. Minister, just a quick one. Adult Education Program, I know where this was previously. Can you indicate what is the impact of this 288,000 decrease? And if you can give us a sense as to the centers that are involved and the programs. If not now and you want to put it in writing, or if you have the answer readily available.
Okay, I would prefer to put it in writing.
Member for Kamuta Manzanella? Okay. Member for Tabakeet?
I would just like to know how many persons are receiving senior citizens grant in Trinidad and Tobago at this point in time. Also, under social assistance, how many persons benefited from the benefited from the 430 million in 2016 and will benefit from the 418 million. Also, the urgent temporary assistance. What is that for? Maybe you'll want to put it in writing, for what purpose is that used?
May I be permitted to stop you?
Yeah.
We still at 006, Educational Institutions.
Sorry, I thought we left that.
Okay? So can we go on now to 007 households?
Yeah.
And therefore your questions will be entertained.
But I don't need to repeat the questions.
Yes.
Repeat
No.
them? No.
No, they'll be entertained
sure.
under 007.
Yeah. And also under the disability grant. How many persons benefited from this disability grant in 2016? And what was the average amount they received? The average. I don't know about for each person, but the average per person that would have been given in that grant. And finally, I'm very worried about the small amount of money allocated to the payment to registrars of births and deaths. And I know it's a stipend, a small stipend given to people, almost like community service. But I want to tell you that there's a lot of work involved to register a debt or a birth, and a lot of documentation to fill out. If you have had to go through the experience, you'll recognize what I'm speaking about. And they have to keep the records there. They have to turn in the records.
It's for the registration of unregistered births. Item 10?
No, 7. Payments to registrars of births and deaths.
Okay.
It's just $11,250 allocated there throughout the country. And I'm asking, why is it so low? And I'm asking, why can't it be raised, if there's a question to be asked.
Let me assist the Minister with that last question. The Registrar of Births and Deaths actually falls under the Registrar General,
yes,
which falls under the Ministry of the Attorney General and Legal Affairs. So I'd like to suggest this is probably an old line item that hasn't been corrected now, and we'll check it back.
Sure.
But we do cover, we cover those expenses.
Yeah. And my final question is, how many persons benefited from the target conditional cash transfer payment program, and whether there's a policy? I'd like to receive the policy, as well as the similar question for the People's Card.
Okay. In terms of the senior citizen pension, as at the end of September, there were 90,800 persons in receipt of that pension. In terms of the disability grant, 24,058 persons. And in terms of the public assistance grant, or what you would have been referring to as urgent social assistance, sorry, it would have been 25,906 families. Yes.
And urgent temporary. You have social assistance and urgent temporary.
Urgent temporary assistance covers more or less, it covers a wide range of grants.
People fire,
yes, and for example, education assistance, prosthesis, all of these things. So I can send you that detailed information subsequently.
Sure.
Member for Kamucha Mansinala.
People's Card, you send that to, sorry? What is the People's Card? Apparently that something came about in 2016.
The People's Card, this is in terms of the biometric card. What is reflected here as the People's Card, this is with the biometric card. Okay? And in terms of the targeted conditional cash transfer program, the allocation here is really to pay for the training for the developmental aspect of the program.
Okay. Member for Kamucha Mansinala.
Thank you, Madam Chair. I have a couple of questions. The first one, I noticed that you said, Madam Minister, you said senior citizens pension, but in fact, it is registered here as senior citizens grant. Can you,
It is registered here. The Ministry of Finance chose to record it here as senior citizens grant, but the legislation provides for senior citizens pension.
Madam Minister, the full amount of for both line 03 and 04 were utilized, 430,300,000 and 30 million, and there was a decrease. Can you indicate why there would have been decreases? Is it that you anticipate that persons will not require assistance for both social and urgent?
This is another instance, Honorable Member, where the Ministry of Finance would have made these allocations.
Member for Couva South.
Madam Chair. Just on a point of clarification, because I'm looking for the line item here, and it could probably guide me, Madam Minister, as it relates to urgent temporary assistance. Does funeral grant fall into this particular line item?
Yes, it does.
And what really bothers me, right, because, and probably the issue will continue to prop up from time to time. What is the qualification for a funeral grant? And I have been faced with numerous concerns from constituents and so on, that in sometimes people's period of grief and so on, when they seek the assistance of the ministries, personnel, and so on in the relevant district, they are faced with a lack of empathy and so on. And they are left in further grief when they seek the assistance of the ministry staff in relation to qualifying for a funeral grant.
So is the question about the qualifications or about the lack of empathy? Which one is the question?
About the qualification, Madam Chair.
Honorable Member, in terms of the funeral grant, it really relates to poor families who are unable to bury their loved one.
Is there any financial limit to qualification and so on? Because constituents are left confused when they go to these offices.
It is usually in terms of the clients that we would serve. However, what I can do, I will send you the details, in addition to which the ministry, there's a department within the ministry that is we have staff who are prepared to come to each MP's office to train their staff so that they will be better able to attend to their people. Very serious.
Okay, item Member for Kamuta Manson.
Thank you, Madam Chair. Honorable Minister, coming back to disability grant, 465 million was allocated in 2016 and 465 million was in fact spent. But there's a reduction, and I would like to know if it will impact upon any person who is in fact receiving a disability grant currently.
Remember, we at item 08?
But there's an increase.
Is it 08 we are on?
Mm-hmm. Yeah, sorry, there's an increase. Sorry. Yes, I'm asking because of the fact that there's with a number of persons coming onto the system, because of the fact recently I read in the papers, Madam Chair, of a woman who had been impacted negatively with an accident, and she was denied. And there's so many accidents that have happened within a short period of time, and persons are impacted negatively, and with Zika virus and so forth, with the children. How will it impact upon if it is you have such a narrow increase in disability grants being allocated?
We anticipate that this would be sufficient to meet the needs, and I think it is important to understand and recognize that you are paid the disability grant when you are deemed to be 100% disabled.
Number 11, the Target Conditional Cash Transfer Program, which is the food card. Can you tell me what it is you plan to do with this program? I see that I don't see anything, an increase or anything. It's just 1 million.
This is in terms of the developmental component of the program.
What it is you plan to develop?
The program provides for, in addition to providing persons with food support, we seek to help develop them so that they come out of that state and become self-sustained.
Member for Oropouche West.
Thank you, Madam Chair. Honorable Minister, line 09, assistance to national heroes. How many national heroes were assisted in 2016? And in what form does this assistance take?
We would have assisted 47 persons in 2016, and it takes the form of a monthly payment. And we can send you the criteria for determining the quantum.
Okay. Item 009, other transfers, page 581. Member for Chaguanas West.
Thank you, Madam Chair. The national item 02, National Social Development Program. There's an allocation of 15 million for 2017. Is this the comprehensive National Social Development Program, or does it have other components elsewhere? Because I know that under the utility sector, you have the National Social Development Program for extension of pipeline for part of the potable water network or electricity. What does this incorporate? Just for clarification.
This seeks to assist the poor and vulnerable in terms of house wiring, sanitary plumbing, house repairs. Okay?
Continuation of that
yes,
program.
and as you would have indicated before, there are other ministries that also has similar programs and similar grants.
Member for Kamuta Mansinala.
Thank you, Madam Chair. Honorable Minister, I do believe that this underutilization of the full amount here allocated in 2016, could you indicate if it was as a result of the fact there were no field officers to go out and assess the various homes and the requests?
No, Honorable Member. What had happened, we were reviewing this entire program because there are aspects of the program, as would have just been raised by Shogunas West, that are covered by other ministries. So we were reviewing it with a view to, should we retain it or should we carry over, for example, the parts that treat with water to WASA and the parts that treat with electricity to public utilities. So that would have impacted what was happening because we were reviewing the program.
Have you reviewed it as yet, Madam Minister?
In light of the fact that the program still remained with the ministry and we had received applications, we processed those applications that we would have received, and these payments were effected, and we have a number of commitments.
But do you have the necessary field officers to conduct the necessary analysis?
I have not been informed otherwise. In addition to which, we have advertised the positions within this unit. It would have been out in the press recently.
How many positions are you looking at? How many positions are vacant, and how many positions are currently occupied?
Just give me 1 minute, please. I have been at NSDP. Sorry, I don't want to keep back the proceedings. I'm having a little difficulty.
No, so
okay, sorry. We have 27 vacant contract positions under NSDP.
Mm-hmm. You have vacant, and how many occupying? They are currently employed?
2.
Nice. Thank you.
Nobody's actual bodies. What would happen is that the others would be there on short term. So it's not that they are
How many in
bodies.
short term then? How many bodies we have short term?
I don't have that exact figure,
That's
but I
okay.
can send it to you.
I appreciate that. Thank you.
Member for Shogunas East.
Thank you, Madam Chair. On 01, the GAP program. As Member of Parliament, very often when I make requests, I find it difficult to get persons to assist these elderly people. Can you tell me from your database, what's the excess of your demand over your supply, and by how much you're short? Because clearly you're short of the amount of persons who can give this, the caregivers that is. So I'd like to know. The question is, well, 2 parts. Number 1, what's the figure in terms of the excess of demand versus the supply? And secondly, what mechanisms are you putting in place to address this shortage?
We currently have approval for 600 caregivers. At this present time, all 600 are not utilized. The difficulty you may be experiencing, or generally, is that these persons are found in different geographic areas. So if there is a high demand, let's say in San Fernando, we may have utilized all of the persons in San Fernando. Mm-hmm. So what we are doing, we are reviewing the program now to see where the greatest needs are, because we need to target the numbers in terms of the geographic locations and where the needs are.
Is it possible for us to have a sense as to where this deficiency is by regions, if you so allocated? So we'll be able to advise on suggestions to assist.
Okay, sure. As I said, we are currently working on getting that data, so as soon as I have it, I will provide it.
Okay. Honourable Minister, you said you had 600 approved positions. 600
caregivers, yes.
Caregivers. Do you have 600 physical bodies?
Yes, we do.
You do. Okay. What criteria is used to allocate a geriatric adolescent partner to a particular citizen? What criteria do you use?
In the normal process, we would get the request. This has to be somebody who needs the assistance either because of the physically incapacitated, and we tend to try to determine whether the person can assist to cover the cost. Where they are unable to, we cover the total cost. Where the individual is able to assist to cover the cost or can cover the cost, that is how it operates.
So you are applying some forms of means test?
Yes.
What is the average cost if you cover the full cost for one such geriatric adolescent helper?
I'm sorry, Honorable Member. Could I give you that subsequently, please?
Yeah. Okay. But can you say what they are paid on the average? One person paid on the average per day?
2,500 per month.
2,500 per month. Thank you.
Subhead 06, page 581, current transfers to statutory boards and similar bodies.
And they're working
004, statutory boards, page 581. Honorable members, we will now move on to the draft estimates of revenue and expenditure of the statutory boards and similar bodies and of the Tobago House of Assembly. Now on to another book, page 525. 15, Trinidad and Tobago Association for Retarded Children, Lady Ho Choi Home, subhead 01, personnel expenditure, page 525, I'm sorry, 001, Lady Ho Choi Home North, page 525. (002) Lady Ho Choi Home South, page 525. 003 Penal Daycare and Training Center, page 525. Subhead 02 Goods and Services, page 525. 001 Lady Ho Choi Home North, page 525. 002 Lady Ho Choi Home South, page 526. 003 Penal Daycare and Training Center, page 526. Subhead 03 Minor Equipment Purchases, page 526. 001 Lady Ho Choi Home North. 00 Member for Shugona West, I'm sorry.
Chair, I just wanted to indicate that I see as a trend, Madam Minister, that there is no increase whatsoever, even in the administrative costs and materials in all these organizations. Is there any kind of contingency that will perhaps operate at the midterm in order to facilitate that? Because things have increased and the pressure. Yeah, so I thought that maybe there is need for some kind of flexibility rather than this kind of Procrustean approach where it remains fixed.
During the year, that is a matter we will bring to the attention of the Minister of Finance once it becomes necessary.
Item 002 Lady Ho Choi Home South. Item 003 Penal Daycare and Training Center. Subhead 04 Current Transfers and Subsidies, page 527. 007 Households. 009 Other Transfers. Moving on to page 533. 41 Trinidad and Tobago Association for the Hearing Impaired. Subhead 01 Personal Expenditure. 001 General Administration, page 533. Subhead 02, Goods and Services, 001, General Administration, page 533. Subhead 03, Minor Equipment Purchases, 001, General Administration, page 533. Subhead 04, Current Transfers and Subsidies, 007 Households, page 534. 009 Other Transfers, page 534. 42, Trinidad and Tobago Blind Welfare Association. Subhead 01, Personnel Expenditure, 001, General Administration, page 540. Member for Couva South.
On the issue of the Trinidad and Tobago Blind Welfare Association, Madam Chair, is there any outstanding monies owed to the monthly paid and daily paid employees?
No, there aren't any outstanding monies. We just paid a total of $3.1 million in arrears.
All right. For what period, may I ask?
That was the last one. 2015-2016 period.
Subhead 02, Goods and Services, 001, General Administration, page 540. Subhead 03, Minor Equipment Purchases, 001, General Administration, page 541. Subhead 04, Current Transfers and Subsidies, 007 Households, page 541. Honorable members, we will now move on to the draft estimates of the development program. So we on to another book. Subhead 09, Development Program, Consolidated Fund, page 259. Item 004, Social Infrastructure, page 259 to 261, member for Kamuto Manzanilla.
Thank you, Madam Chair. Honorable Minister, page 259, line item 044. Can you identify where the social displacement centers will be?
This is in terms of the center that we intended to establish on Queen Street. However, the structural integrity assessment was done of the building, and the Ministry of Works and Transport would have deemed the building structurally unsound. So we were not able to proceed with the construction of that center and the outfitting.
Okay, but you said establishment of social displacement centers. I was asking where.
Given the fact that we were unable to construct a center at Queen Street, we are looking for alternative locations.
Do you intend at all of this dismantling the current structure and utilizing the property that was identified originally for the street dwellers program?
A decision has not been taken with respect to what we are going to do with the building, because there are different options open to the ministry.
Has the minister at all met with key stakeholders in providing a way forward?
Given that we have not made a decision and we are not in a position to indicate where the alternative site is, we have not held such discussions with the stakeholders.
Member for Princess now.
Madam Chair, through you to the Honourable Minister. Honourable Minister, line item 036, establishment of a substance abuse rehabilitation facility at Peparo. Madam Minister, there has been a lot of issues regarding this facility. Can you give us an idea of what is happening now with respect to the work that is ongoing at this facility?
I am not sure what issues you are referring to, member for Princestown, because the Peparo Center is one of our great success areas, in that we have had a number of persons who would have graduated out of the program. This money that we have allocated is in terms of constructing a walkway around the pond, because we are setting up a tilapia pond for the center. And we are also going to construct a new guard booth, redesign out for the old administrative building. So that is the work that needs to be done there. But I am not aware of any issues that adversely impact that center.
Well, Madam Minister, I'm happy for the explanation, because I should have been a little bit more clear with regards to the issues. But when you spoke about the walkway and the construction of the guard booth and so on, Peparo falls in the constituency of Princestown, and I know for a fact that there have been problems with respect to persons enrolled at the program there, coming out into the communities and so on, getting themselves involved in some activities that probably they should not have been involved in. But I know for a fact that members of the protective services have met with me on several occasions, and some of these issues did arise. So I'm happy to hear that there would be a greater emphasis in terms of securing those within the facility. So I'm happy to hear about that.
Thank you, Madam Chair. Honorable Minister, line item 076, establishment of social services center in Point Fortin. Is this to replace the office in the sub-office in Cedras?
No.
Are we going to keep Cedras?
Yes, we are.
Is it going to be reopened?
It has never been closed.
With all due respect, Madam Minister, I have visited and I have been told that it is closed. And I've been given the reasons why.
So, member, do you want to ask the minister to verify whether it's open?
Yes, please.
Madam Chairman, I do not need to verify if it is open. The center is open. Initially, the center was open on specific days during the month. So if it was being open on a Friday and you went on a Wednesday, you would not have met anybody there. We have since sort of put systems in place where we can have the center open on an ongoing basis.
Thank you very much. Member for Shogunas West.
Thank you, Madam Chair, through you. 096, Development Center for Persons with Challenges. See, there's an allocation in 2017 of 4 million. What is the nature of this, and what does it really in fact do, and what are the challenges we're seeking to address?
This is in terms of the center at Castlefield, National Enrichment Center that I would have spoken about before, where we would have had a number of issues where the building wasn't built to the design brief. It could not accommodate, it wasn't built for the purpose it was intended, in addition to which we subsequently discovered that the statutory approvals had not been received. So we are now in the process of having those approvals granted, and then we are going to do all the remedial work and outfit the building.
Member for Kamutu Mantinala.
Honorable Minister, line 112, the Street Dwellers Rehab and Reintegrated Project. Could you expand on that project, please?
This refers to what we call Riverside Car Park. And this large allocation has to do with the fact that we need to do an entire overhaul of the electrical system and do a facelift of the building. So we are going to be spending approximately $3 million on the electrical overhaul and outfitting of the building, and the balance is to paint and renovate the building.
Is the Honorable Minister planning to decommission the building while you are in fact doing the works and relocate persons? How you plan to do it?
No, our project people have indicated to us that is not necessary, and we have been working around the persons who are currently housed there.
Thank you.
Item 005, multi-sectoral and other services, page 261. Infrastructure Development Fund, page 365. Item 004, Social Infrastructure, page 365. Honorable members, The question is that the sum of $4,755,638,165 for Head 78, Ministry of Social Development and Family Services, stand part of the schedule. Those in favor say aye. Aye. Those against say no. I think the ayes have it. The sum of $4,755,638,165 for Head 78, Ministry of Social Development and Family Services, now stands part of the schedule. Thank you, Minister. PS and other technocrats.
Please, I would like to take the opportunity to thank all the staff of the ministry for all of the work they would have done to prepare us for both the budget presentation and this afternoon. Thank you.
You're welcome. Head 39, Ministry of Public Utilities. We're now going on to page 282 of the draft estimates of recurrent expenditure. Page 282. Estimates of recurrent expenditure, Head 39, Ministry of Public Utilities. Head 39, Ministry of Public Utilities, $2,867,909,500. I will now invite the Minister of Public Utilities to make a brief opening statement, not exceeding 5 minutes.
Thank you, Madam Speaker. The Ministry of Public Utilities has been in existence since the commencement of the public service. Over time, it has consistently adapted to the evolution of our nation and to changes in its portfolio. The arm of government that is charged with the management of policy development underpins the utility sector and provides strategic oversight of the agencies in the sector in respect of the management of their operations. The utility sector is comprised of a complement of 3 state enterprises, 4 statutory bodies, and 2 departments of government, which are responsible for the delivery of water, electricity, postal, meteorological, and telecommunication services, the management of wastewater and solid waste removal services, the provision of regulatory services for the water, wastewater, and electricity sector, the provision of janitorial and security services for the nation's schools and government entities. The ministry's main strategic objectives are to provide effective and efficient leadership and governance to the utility sector, ensure the utility sector is modern, customer-oriented, and technologically enabled to provide efficient, cost-effective, quality service to the national community, to collaborate with the state enterprises and statutory bodies comprise the sector to ensure that they practice prudent financial management with a view to becoming financially viable. At this time, the ministry staffing complement, inclusive of 2 departments of government under its purview, is 354 employees. Of this figure, 181 are establishment staff, 173 are contract employees. The Ministry of Public Utilities and the state agencies that comprise the sector provide the foundation upon which the national community rests, especially in the area of industry and commerce. Having regard to the importance of the utilities of the national community, the ministry has embarked upon a program of enhanced monitoring and evaluation of the agencies to ensure the efficient provisions of services, the timely implementation of projects within budget.
Thank you, Minister. Honorable members, the question is that the sum of $2,867,909,500 for Head 39, Ministry of Public Utilities, stand part of the schedule. Honorable members, the sum of $2,867,909,500 $867,909,500 for Head 39, Ministry of Public Utilities, is comprised of monies proposed for expenditure under the following subheads and items to be found in the draft estimates of recurrent expenditure, the draft estimates of the revenue and expenditure of statutory boards and similar bodies, and of the Tobago House of Assembly, and the draft estimates of the development program. We now proceed to consider the draft estimates of recurrent expenditure. Subhead 01, Personnel Expenditure, page 282, Member for Chaguanas West.
Thank you, Madam Chair. Through you. Item 08, vacant posts, salaries and COLA without incumbents. There's an increase of $400,000 in this area. I'd like the Minister to provide us with certain data. How many posts are presently vacant? What is the classification of the vacant positions? What is the estimated time frame for filling those posts? What are the specific posts which are currently vacant? How many vacant posts are catered for under the sub-item vacant posts?
There are 429 posts in the head office, a total staff of 354, of which 173 are contract workers, 181 establishment. There are 75 vacancies. Establishment has 23 and contract 52 vacancies. And we intend to fill these vacancies as soon as possible.
Minister, could you give us an appreciation of the nature of those vacancies?
There are 10 positions, technical and meteorological service. The skills are expected to be filled at the Service Commission department within next fiscal year.
Item 0. Tabaki? Member for Tabaki?
Minister, is it that you cannot get people with the qualifications to fill these jobs? Or is it that the Service Commission is taking long to fill these jobs? Because we have so many graduates out of the University of the West Indies looking for work. Why is it that you seem, not only all the ministries, seem unable to get people into these jobs? And there are so many vacant positions in these ministries.
And you only ask him with respect to the Ministry of Public Utilities?
Yeah.
We are dependent on the Service Commission for filling these posts.
Can you not fill them on a contract basis in the meantime?
Some of the posts are contract posts and some are.
Can you not go to Cabinet and Cabinet give you permission to employ people in positions, a contract in these jobs, so that at least you get the work done and you get people employed rather than graduates are frustrated coming out of the university and they cannot get work?
We intend to address that. If you look at sub-item 34, you see there's a university graduate recruitment program of which $1 million is allocated.
No. Just 1 minute, please. Thank you, Honorable Minister. Member for Tabaki, we are under 001 General Administration.
Salaries and cost.
And I think all of us are quite aware now that these talk about the posts under the establishment.
It says it includes provision for vacant posts with incumbents.
And we know that these belongs to posts on the establishment. Okay? So, anybody else under 001 General Administration? Yes, Chaguanas West.
Thank you, Madam Chair. I see that you have no allocation for cabinet appointed committees for 2017. So could you give an indication as to whether or not?
What head is that?
Item 14, line item.
Yeah, line item 14. Remuneration. None. You have no cabinet appointed committees.
No, none of the general administration.
Okay. Met services? Oh, you're rich, yes.
Very anticipatory. Item 002, Met Services, Chaguanas West.
Could Honorable Minister, through you, Madam Chair, could you give us an indication of the number of persons employed in the Met Services and the whether there are any vacancies and what talent pool that you have in those vacancies required.
That information I'll have to get back to you with.
Item 005, Electrical Inspectorate, page 283.
Another question, Madam Chair, for the Electrical Inspectorate. So how many persons, how many vacant positions, and what are the kind of positions that are in fact vacant and the qualifications required?
I'll have to get that information back to you in writing.
Member for Tanki. Sorry.
Yeah. Okay,
More specifically, in San Fernando, how many electrical inspectors are there in the division now? And why does it take such an inordinately long time to get an inspector to come and inspect a building? Not knowing me.
Minister, in a position answer?
No, again, I'll have to get that information for you.
Member for Shogunas West.
Madam Chair, I want to, the reason why I ask those questions is because the Electrical Inspectorate is supposed to inspect a building every year. And if you get a electrical surge and your appliances are damaged, the TNTech hides behind the fact that you have not been inspected on an annual basis and you are not in any way compensated for this damage to your appliances. So it is clear that there is a compelling need to deal with this inspectorate. But I am of the view, Madam Chair, that you cannot deal with it within the public sector too. And I want the Minister to seriously think there was a move to get private sector involvement in this sector with a view to getting that, fulfilling the requirements of the law.
And the question
I want the Minister to contemplate that in his ruminations as to change in the sector. Yes.
Yes,
So
I will contemplate it.
Very well.
Okay. Item 006, Government Printry, page 284.
The government printry is no longer under the Ministry of Public Utilities.
It's under communications.
Yes.
Item 007, General Administration, page 284. Subhead 02, Goods and Services, page 285, item 001, General Administration, pages 285 and 286, Member for Naparima.
Thank you, Madam Chair. Item 08, rent lease. I see an estimate of 5.8 million. Would the Minister indicate to us where this property is, who is the landlord, and what is the reason for the 300,000 increase?
The rental of that office is 1 Alexander Street at $675,000 per month, and that is the amount required in addition this year.
The additional amount?
Yes. Prior to this, we were occupied at Elizabeth Street. So it's a new premises that we have occupied as the increased cost for the year.
Member for Couva South.
Thank you very much, Madam Chair. Under 16 as contract employment, there's an increase in the 2017 estimates by $3,400,000. Could the Minister provide us as to a breakdown of the number of persons who will be recruited under this contract employment, and what is the criteria that will be used to increase the contract employment in his ministry?
This is as a result of a retention of positions under the ministry's 6-year plan, Cabinet Minute for 2015, and the filling of vacancies for the establishment of the Ministry of Public Utilities.
Member for Couva South.
Yes, as I said, how many new positions will be filled? Could the Minister provide us, and what will be the process as it relates to filling of these vacancies?
Some of these posts came from the Ministry of the Environment and Water Resources that was absorbed into the Ministry of Public Utilities, and advertisement will be placed in papers for the post, the vacant post.
Still trying to find out the relevant positions, whether it will be 5 of this, 2 of this, 1 of this, and so on, Mr. Minister.
That information can be provided for you at a later date.
And what will be the qualifications and the criteria and so on?
Most certainly.
Member for Tabakit.
Under item 53, refunds to Wassery water improvement rate. Firstly, I'd like to understand what is this refund to Wassa, and secondly, whether this amount of 240 million, which is recorded here for the first time in 2017, there was nothing before that, is included in the 1,697 million subvention that Wassa also gets.
Under the water,
additional.
Under the Waterworks and the Water Conservation, Wassa receive on behalf of the government payment of water improvement to the supply of industrial and commercial rates, in particular to the Point Lisa's industrial estate. Right. So this money is involved in the payment for Wassa for the water used by the industry.
So the industry pays this to Wassa and Wassa refunds it?
Yes, to government.
The pays it to government and government refunds it to Wassa?
To Wassa.
But government receives it from the commercial enterprise.
Commercial enterprises.
Right. Is this amount of money included in the $1.697 billion that is the subvention to Wassa?
No, this is not included in that.
So then you add this to that?
Yes, we do.
So it's more $2 billion Wassa will be getting subvention in this year?
Yes.
Okay. Member for Naparima.
Back to item 08. The minister indicated that the monthly rent was in the vicinity of 650,000. Did I hear him correctly?
675,000.
675. Well, yes. If you multiply that by 12, it means that the estimate of $5,800, 5.8 million, sorry, is inadequate to the figure you stated.
So is that another media review?
That would put it at approximately $8 million.
So Rodney watching out for files.
Yeah. I'm not following.
I suspect it's a typographical error.
No, it's not.
No, it's a budgeting. Yeah, type.
Yeah, we occupied this building from the 1st of August, so we adjust with the junior material.
Okay. Member for Chaguanas West.
Yeah. Item 22, number 22, short-term employment. I see that there is a decrease in the short-term employment from 2.6 million in 2016 to 1 million. How is that going to impact upon the operations of the Ministry of Public Utilities? And
that's the amount allocated to the Ministry of Public Utilities by the Ministry of Finance, and we will adjust to be able to work.
What is the purpose of the short-term employment, and what field you provide that facility? Through you, Madam Chair.
Yes, we'll get this data back to you.
Madam Chair, I noticed that there is the street lighting program. Could the minister give an indication of whether this is payment for TNTEC for street lighting program, the street lighting program, or is this this 75 million in 2017 estimate, which is an increase of 5 million from 2016? Could the listing of the areas that will be so provided if a new facility is going to be provided?
The National Street Lighting Program is an ongoing program that is more or less about 99% of the grid is involved. So this will be just for the allocations for the year.
Allocation for what? For the continuation of the program, the completion. Minister, I know a great deal about this program because I started it in 1997. So I just wanted to know whether or not this is a completion.
It's just a continuation of the program.
Member for Couva South, and then Kamuta Manzanella.
No, welcome.
Member for Kamuta Manzanella.
Thank you, Madam Chair. Honorable Minister, the street lighting, have you designated areas that you will be focusing on, or is it just going to be as the need arises?
Well, the program is being adjusted. For instance, TNTech is going on to possibly a change in the type of bulbs, going to LED lighting, right? So it's an ongoing program. There are some pilot projects being done throughout the country in terms of the new bulbs that is less cost effective. So therefore, it's an ongoing program.
It's
more cost effective, sorry.
Yeah.
Right, so it's an ongoing program.
Member for Kamuta Manzanella.
Have you identified any of these projects in the constituency of Kamuta Manzanella?
Yes, definitely. Based on the request from councillors, the request from the corporation, yes, we'll address these areas.
Are you trying to say that it must come through the corporation, or can a member of parliament send as well?
Yes, whenever you all send requests to me, I act on it speedily.
Member for Couva South. Member for Couva South.
Under this, thank you, Madam Chair, the street lighting program deals with lighting of recreation grounds and so on.
Is it a question?
Yeah, well, based on the response from the minister.
The street lighting program plus recreation grounds program, yes.
So with this increase in $5 million, could the national community be reassured that there will be no hiccups as it relates to the lighting for Ramlila for the next year forthcoming?
If, as needed, we would make representations to the Ministry of Finance to include any additional cost in the upcoming year. In terms of the Ramlila, be quite key. I realize that you keep requesting, raising this issue. On the 20th of September, a request was made for grounds to be lit in terms of the Ramlila. On the first week, at 9:10 p.m., there was nobody in the facility and the lights needed to be adjusted.
Madam Chair,
on
I asked
Wednesday
the
12th,
question.
On Wednesday 12th,
Madam
at
Chair,
9:10,
I asked the question, could the minister
Thursday 13th,
give us
Member.
a reassurance that there will be no hiccups
Member
for the next year?
Member for Couva South. Maybe if we are a little patient, we might get to the end of the answer, which will deal with everything that you want to know. Member for Couva South. Okay, and all members, if we just need to be reminded, we are now at the third item of business, and remember, we intend to complete at least 8 at whatever hour we complete that. Yes. So it means that, member for Couva South, your question has been answered.
Right.
Your question has been answered? Yes, please. Member for Kamuta Manzanella.
TNTech will be providing the electricity necessary for the Ramlila, as we have always.
Member for Kamuta Manzanella.
Honorable, thank you, Madam Chair. Honorable Minister, can you advise whether you will be, in addition to the street lighting project, if you will be looking at the putting down the new infrastructure for street lighting? Will that include that as well, as opposed to just more or less rehabilitating? 42.
Isn't this recurrent expenditure that we're on?
Yes, recurrent expenditure.
Yes. Okay, so member, maybe you could reserve your question
Yeah.
for the correct
Thank you. Will do.
category. Item 002, Met Services, pages 286 and 287. Member for Chaguanas West.
Thank you, Madam Chair, to the Honourable Minister, through you. Item 16, contract employment. Could you give us a sense of the nature of the contract employees? Secondly, training. I noticed that there is a decrease in training, and this is an area in which there is significant need for training. Could you explain, because of its nature with international and regional organization, could you give an explanation for this decrease in training?
At this point in time, I would furnish you with that information.
For both questions?
Both questions in the future.
Now, the third issue, item 27, official overseas travel. Point I'm making, Madam Chair, through you, is that the meteorological services interact and interrelate with a series of regional organizations and international organizations. And I see there's a reduction to $50,000 in their overseas travel. An increase of only, well, you had none for 2016. So what you have 2017, 50,000. So a very minimal amount for official.
As the need arises, in a midterm review, if there's any need for additional funding, we'll make a request to the Ministry of Finance.
Okay. Item 005, Electrical Inspectorate, page 287. Can I skip item 006? Oh, Member for Couva North.
Thank you, Chair. Line item 08, rent, lease, office accommodation and storage, an increase by 215,000. Minister, can you clarify?
Yes, I saw it somewhere. Rental of office in Aruka, pending negotiation for increase in the rate. And the South office, this is the reason why there was an increase.
Let's get 1.3.
Thank you, Madam Chair, through you to the Minister. Item 16, contract employment. There's an increase by $445,000. Could you give us an appreciation of the number of contract employees, the capacity in which they serve? Because it seems to me that they're beginning to, in my mind, get a kind of revolving door. People retire and come back. So let us get an appreciation of that, because to fill this need in the electrical inspectorate through the establishment.
Since December 2015, 18 electrical inspectors were employed, and I will give you a breakdown in the future allocation.
Okay, so item 006, government printry, and for reasons explained before, can we skip this and go on to item 007, general administration at page 289. Subhead 03, minor equipment purchases, page 290. Item 001, general administration. Item 002, Met services. Item 0, are you under 005? Electrical inspectorate. Item 006, government printry. Item 007, general administration, page 291. Subhead 04, current transfers and subsidies, page 291. Item 001, regional bodies. Item 003, United Nations organizations. Item 004, international bodies. Mutamanzinela. Item 007, households, page 292, Kamuta Manzanella.
Thank you, Madam Chair. Honorable Minister, line item 06, the UAP. Can you advise, I know that in a subsequent release, there was an indication that 125 persons were identified who would receive the newly formatted 125,000 persons, yeah. And I'm asking, would this this UAP, would it impact upon those persons at all?
That is UAP?
Utilities Assistance Program.
We arrive at there yet?
Yes.
Okay.
We are page 292, 007, 06, Utilities Assistance Program, under households.
I want you to shed some light on that, please, Minister.
Yes, could you repeat the question?
During your budget debate, you had indicated that there will be a 25% rebate, I believe it is, and yes.
Every 400.
No, this is not the same thing. That was a provision of the budget, 25% decrease in tea and tech bills. But this is not part of the utilities assistance.
So this would not. With this program that you have here, would you continue with it? Would it work in collaboration, in tandem with also the Ministry of the
Social
Development? Yes. So would one of the ministries be removing their program, or will it maintain each?
They will maintain each.
Wonderful. Thank you.
Could I?
Thank you, Madam Chair. Could you give us an appreciation of what are the elements that you have currently on the Utilities Assistance Program?
We have a bill assistance where we assist people who qualify in terms of payment of the water and sewage bills. We also have a water tank assistance. People who are not a part of the water grid, we provide them with tanks, water tanks. We have assistance in terms of solar power. If somebody is off of the electrical grid and it is not cost effective to bring power to them, we provide them with solar panels. Those are part of the utility assistance program.
Could you give us an appreciation, perhaps in writing subsequently, of the beneficiaries of this program and the areas that they are located?
Most certainly.
Member for Caroni Central.
I just have a question in relation to the utilities assistance. Is through the RIC, is it likely that utility rates are going to move upwards? And if it does, how is it going to affect some of these programs? Or have you not gotten to that point yet? I realize I'm asking you something that is projected, right? And I'm not trying to be problematic. I just want to understand.
If utility rates went up.
Well, RIC, I know, has made recommendations for increase in utility rates. And that will be addressed at some point in time. Either it'll go up or it'll stay the same or whatever. But I just want to know, how will that affect what is essentially a new policy to try and supplement what exists already in terms of support for households that cannot meet their requirements?
Under Utilities Assistance Program.
Both TNTech and WAS have applied to the RIC for rate increases, to examine their rates. Trinidad and Tobago, right now, we are under the lowest rates, some of the lowest rates in the world, right? Whatever adjustments is made, whatever decision is made by the RIC in conjunction with TNTech and WASA, we at the Ministry of Utilities, Ministry of Public Utilities, will adjust to suit to make sure that all those less fortunate in the society are not, and do not come out adversely in terms of an increased rate.
So if there's a recommendation to increase, the ministry will go along with that and address the issue of those unable to meet their obligations, right?
Remember, you're asking two questions, and I really think the minister could only speak in terms of the Utilities Assessment Program. So if you're asking him a supposition, you're not asking him about RIC. You're asking him about if it's increased, if there's an increase, what the ministry will do.
That is correct.
That I will allow.
The ministry will continue to look after the interests of those who are less fortunate in society.
Okay.
Member for Kamuta Mansinela.
Thank you, Madam Chair. Honorable Minister, Is there a range in which anyone can apply, whether it's for water tank or solar system and so forth? Is there a ceiling in which that you can?
There are certain criteria that you have to satisfy. And we send out people to...
Is this public information, the criteria?
Yes, it is public information. You could go to the Public Utilities website and get that information.
Okay, and for persons who don't have access to computers, because we're dealing with
well, during the last year, the Ministry of Public Utilities have been going out to the consumers. We are visiting them both in terms of in the constituencies as well as in terms of the regional corporations. So we have been going out and meeting with the citizens and explaining to them the benefits of the Utilities Assistance Program.
Okay, great. Thank you.
Item 009, other transfers. Member for Point of Peer.
Thank you, Madam Chair. To the Minister, under the transfers, line item 04, the TT post. And the original estimated 2016 was 55 million. The revised estimate went up to 76 million, a $21 million increase. Could the Minister state what was the reason for that increase during mid-year in 2016?
Line item, page and line item.
Was it back?
00904, page 292, Trinidad and Tobago Postal Corporation.
Other transfers. Yeah, that would be settlement of the arrears, 50%.
Okay.
Member for Chaguanas West.
Thank you, Madam Chair. Through you to the Minister. The items 02 and 03, Water Resource Management Unit. I'd like to find out what is that unit? Does it have anything to do with the Integrated Water Resource Management Strategy? Secondly, the 03, the Waste Recycling Management Authority. What is the status of that body, and where is the legislation at in bringing this entity into being?
We are in the position of creating the Water Resource Authority. We have gone to a consultant to assist in that area. This would be involved the separation of the water resource management from the water transmission and distribution. In terms of the Water Resource Management Authority, in terms of the Waste Recycling Management Authority, funding is to be used or approved by National Water Recycling Policy as a subset of the overall
Waste
National
recycling.
Integrated Solid Waste Management Policy. It's all part of a process that we are going through.
No, Minister, perhaps I was not clear in my question.
Go ahead.
My question is that you have a line item for a Waste Recycling Management Authority. It is a process by which there has been significant consultations, and that therefore there is a new entity to come into being. It requires legislation. And my question was, what is the status of the process currently?
I said we are in the process of involving a consultant that would go out and do with in terms of the stakeholders and have consultancies throughout the country in terms of carrying this process forward.
Okay.
Item 0. Kamuja Manzinella, you have a question? Last question on 09 then.
Yeah,
009.
as Madam Chair, through you to the Minister, there are a series of loans. For example, repayment of loan to the National Gas Company, which is 322 million 070, an addition of 5.592 million. Is this, then you have the TNTech loan, repayment of a loan to Recove Power Station, repayment of a bridging loan, repayment of 8-year-old bond facility, repayment of 14-year-old bond facility, and you have significant sums. The 16 and 17 is a new sub-item, but I want to know whether number 13, line item 13, will that cover all the debt to National Gas Company?
Certainly not. No, it will not.
How much is owing, and other than beyond the payment of this 322 million for 2017?
is being quantified, but it runs well over $1.5 billion.
Okay, could you, Honourable Minister, provide that?
We provide information.
We can get an appreciation.
Certainly.
And the repayment of the loan to Cove Power Station, at the end of this payment, Cove Power Station, line item 14.
Yes.
When this is repaid, could you give us an appreciation of the exposure? That how much is the loan, and we are paying 54 million this year, and the estimates an increase of 101,000. At the end of that payment, what will be our exposure in terms of the additional loan facilities?
Yes, the loan is $76 million US. Repayments commence in 2010. We have had 2 payments totaling 8.1 million and 54.2 million.
Could you put that in writing for us,
Certainly.
Minister? I appreciate it. And similarly, the 16 and 17, the repayment of the bond facilities, which are 2 new items. What are those bond facilities for?
That's the 1.6 billion for TGU. It's an 8-year and a 14-year-old bond.
Okay, so that was the money used to purchase the interest in TGU. Okay. No, I mean,
the interest.
I suspect what these items are is, you would recall, in the last 5-year period, the declaration on the settlement of the dividends from TNTEC to TGU. The payments from TNTEC to TGU, so TGU can then pay dividends.
So they took the bond and they paid TGU.
Correct.
So it's one hand to the next.
Correct.
Yes, and those are guaranteed loans by the government.
Good.
Item 011, transfers to state enterprises, page 293.
The Solid Waste Management Company, item 02, you have an allocation of 75 million. That seems to be the general recurrent expenditure. Now that you have increasing the facilities for the workers at the BTAM dump, does it take into consideration that, or does? I know it has development, so that the recurrent remains the same. There is no expansion in the recurrent here.
Not at this point in time.
And MTS similarly, the increase of 4.6 million. Does this increase incorporate the new wage agreements?
Yeah, this includes the arrears owed to the workers.
Okay.
Okay. Member for Caroni Central.
Could I, I mean, I don't know if you'll allow me, Chair, but given what we have here under other transfers and then the transfers to state enterprises and so on, and given the policy on, given the amount of debt, given the prospect of increased revenues to address some of these issues, and given the policy on subsidizing those who cannot meet the requirements of payment, is the government clear on what, policy measures they are going to take in relation to the utility sector, in this particular case under your charge as minister? And I'm talking here about electricity and water. It has implications for other things such as TSTT, but I won't bring that into it. I mean, is there clarity on that? You have debt on the one hand, you have loan repayments to meet, you have the prospect of making electricity and water rates reasonable in terms of the global situation and in terms of the losses. And then you have the policy that has to do with subsidizing those who are not able to make it. I mean, is there policy clarity on all of these things?
Yes, there is. There's policy clarity in terms of water. We are creating the Water Resource Authority in a conjunction with WASA. In terms of TNTEC, we are, again, matters are before the RIC in terms of dealing with the new rate increases. And there is intention in terms of WASA to go into metering of both residential, commercial, industrial facilities, to deal in terms of increasing the revenue of both WASA and TNTEC so that they will no longer be dependent on the government for all subventions.
Okay, but that ultimately is going to have an impact on all consumers. Huh?
It will have.
Right.
First.
Thank you, Madam Speaker. Through you to the Minister. Minister, I saw that you said that you will go into metering. I want to just indicate that you can only meter if you provide water, and that therefore if you go into metering, whether it's smart metering or manual or digital, or you will have a problem if you are not providing the water throughout 24/7 in the whole system. So that therefore your goal really ought to be to move from the 74% which you inherited 24/7 to 100%, and then bring on your metering program.
Water for all.
Yeah, right. And then you meter.
Noted.
Okay, so members, might I suggest that we take a suspension now and return at 5:30.
5:30, Madam Speaker.
5:30.
Yeah, I'm a thing.